Okay, I mean, people are coming in dribs and drabs, so I think it's best to get started. So, hi, thank you so much for coming today to our co-produced symposium on COVID's impact on youth mental health. Please feel free to say hi in the chat, introduce yourselves. We're going to primarily be talking amongst the chat today, just because there's so many people. And please put the questions for all our speakers in the chat as well, and we'll do our best to relay them back after each session. Just to highlight, first of all, I guess the housekeeping, sorry, we are sold out today. We're hoping for around 250 people, but we are recording it. So if anyone else of your colleagues would like to see after the event, please let us know. We'll also be putting it onto social media so everyone will be able to see it after the event. If you can keep your microphone muted and video off, that would be handy. And I'm just so pleased to say that over the last few months, we've been co-producing these events and the symposium with young people, with 8 young people, and we've been putting off on after school specials in the last couple of weeks and focusing on key priorities for sleep, and asking for help and getting support, because that's what the young people wanted. And all events and after school events were in the style and structure that they wanted. So it's just to highlight how important it is to listen to the young people. And this is just a straight away an impact of involving young people, and they changed our name as soon as we started to A New Tomorrow. So each project today that is featured will be informed by young people, and we are starting off with a completely youth-led project, which I'm really happy to sort of start off with. And each session is chaired by one of our young producers. And up first is Nathan. So over to you, Nathan.
Hello, everyone. Yeah, I'm Nathan. I'm very glad to be one of the young, well, almost young co-producers. But yeah, to echo what Lindsay said, use the chat box, ask questions, ask about the weather, but also ask about the research, and we'll get those to the presenters at the end. We'll be covering some very important topics. So I will hand over to the very important people. I'll be using first names, just to try and keep it as human as possible. So up first, we have Rana and Jay with their academic project using theatre to, well, it's a very youth-led project, which is also great, to talk about young people engaging with COVID research reports through theatre. Yeah, sorry, misread that, but that's great. That's very interesting. So I'll hand over to you guys.
So yes, hello, my name is Jay and I'm one of the people involved along with Rana, and we took part in a summer project of, as it says, engaging young people into COVID-19 research. It was all of the reports that we used as stimulus were supplied by the Imperial College. It was created by the Applied Research Collaboration Northwest London, and it was funded by NIHR. And that burnt orange theatre company logo there is the theatre company that sourced all of us, so all of the actors, writers, and directors.
Hi, I'm Rana, and first of all, just to point out, I'm actually zooming in from school, so if you can hear screaming children, then it's probably that, because I'm like right near the field. So but yeah, so why should we engage young people in research? First of all, we're hugely impacted by the pandemic. For example, mental health reasons alongside physical reasons. They have lots of experiences to share. We can help come up with creative ways to make research more accessible, such as coming up with the academic project using the form of theatre, and also to widen young people's knowledge of research and patient and public engagement and involvement.
A bit of background for the project, so kind of where we were coming from, or where the Burnt Orange Theatre Company in general was coming from, was bringing together a group of 11 young people who initially said that they disliked long reports and statistics as a way of communicating information. The pandemic had a definite negative impact on their mental health. Their engagement in COVID-19 decreased over time, and they felt like an invisible community.
Just a bit of background about the young people. So we all applied through social media adverts. Burnt Orange Theatre would put on their Instagram and their Twitter that this project was going to happen, so all the young people could find out through that. They were all selected from underrepresented backgrounds such as ethnic minority groups, disabled groups, etc., etc. And there were 5 groups in total, and each group would have a mix of different abilities. So each group would have a person with a director or an actor, or all groups would have script writers that kind of led the project in the way that they saw it, basically.
So the makeup of the group in terms of all of the young people involved was 50% were part of a non-white community, so ethnic minority groups, Black, Asian, and 85% were state comprehensive educated, 10% were state grammar, 25% had run-ins with pupil premium or free school meals, and 45% said their parents do not hold a university degree.
The project timeline essentially was like this. So there was the launch of the event when we started it, and everyone just got in their groups and started meeting new people and stuff. Then we had youth-led rehearsals when we would meet up on Zoom, and the writer would basically ask everyone what they kind of thought the end result should be from our project. So we would say our ideas and like devise a short plan. Then the writer would go off, draft the script, and come back with it and see what we thought about it, and then we could like make changes and add to it or whatever. And then there was actually a meet the researchers session when we got to actually meet the researcher behind the report. So we got a better understanding of the report because we got to ask them questions, and that for my group in particular inspired us to incorporate more of the report into the performance at the end of the thing. And lastly, we recorded our videos and uploaded it to the Google Drive, and so it was like all finalized and everything, and we had a showcase where all our friends and family could come along and watch what we have created, which was really nice.
So in terms of our reports, as I said before, these reports were sourced to us by the Imperial College, and we used this just as a stimulus. So for us to read the reports and make the performance that would kind of surround it, so that would coat it, and that we would help to deliver the information of the reports and possible implications of it. So for these 5 reports, we had estimating the potential total number of novel coronavirus cases in Wuhan, public response to the UK government recommendation on COVID-19, impact of non-pharmaceutical interventions on COVID-19 in 11 European countries, equity in response to the COVID pandemic, and relative sensitivity of international surveillance.
I'm not going to talk about my experience on the project. I hope you don't mind me waffling a bit, but my experience was actually really great and fun and fantastic. I got to work on a project with so many new people. I got to meet different people, and I signed up because I saw a new opportunity to perform and create, because I love performing and I love like the whole acting world, and I also kind of wanted to like learn a bit along the way, because it's like performing is not just about reading a script and then doing it. You actually have to like learn a bit of stuff and stuff like that. So yeah, I heard about it in actually a focus group that Fola led at Burnt Orange Theatre during the summer, because I did a summer course with them. So that's how I kind of got the chance to really notice that I wanted to do it. And I think my favourite thing about the project was meeting new people and collaborating together to devise a piece that really captured raw emotions through the different characters we would see in lockdown, because our report essentially highlighted what the different responses to the lockdown announcement. So we wanted to say how one person might feel a bit anxious, or one person might feel a bit like happy that now they've got a chance to like reflect on themselves a bit more. So we wanted to show contrasting views to give a realistic approach to our report. So yeah, it was really fun and engaging as well.
So yes, that handsome man is me. My experience with the project was a similar one to Rana's. This was my second project with the Burnt Orange Theatre, so it was nice to get back in touch and see some familiar faces, be in familiar spaces. And yes, so in terms of what we did, our report was a kind of rundown of May 2020 of the pandemic. So it was the lockdowns and pandemic in the UK in the wake of consciousness rising towards globalized issues, racialized issues, and things that would otherwise go under the radar were it not for the heightened consciousness that lockdown naturally gives. So we spoke on that, as well as lockdown issues, financial, economic issues, on its impact on people of lower classes, and what that, again, the implications of that, what other people it affects, how it affects them. But in terms of my practical and like personal experience of it, it was quite nice. It was nice to perform again. The way we did it is it was all done remotely. So we would have an initial call from Ella and Rosie, who are two leaders of the Burnt Orange Theatre Company. And then outside of those check-ins, we would have our own independent calls where we would talk about writing and scenes and breaking up the lines and how to make it more engaging, costumes, characters and everything, because all of us did more than one character. And it was altogether a nice, fun experience. We had like a courier come through and give like a camera to each house, like the same camera to each household. You film your scenes, give it back, and then it will get spliced into one, which there will be a clip of this short specifically, I think, at the end of this presentation. But yes, so that was my experience on it.
So what have we learned from the project? A few of us had said it got like that we got closer to research and gained an understanding of how research is done. We also learned how to produce a film during coronavirus restrictions. And one researcher actually quoted what they learned is that talking to young people was an absolutely enjoyable experience and an opportunity to talk about aspects of my work that go beyond the scientific results of my research.
And so from this, some kind of curated, distilled little top tips for involving young people based on what we've done with this project and further work, speaking as someone who has gotten more involved with Imperial College after this initial project, would be to kind of use something creative, do something creative, even if it's not just theatre. If the information is delivered on something, then that usually tends to a better reception. So it doesn't feel like work. It doesn't feel like university lectures or school lectures that people have been sitting through all the year, like all year and most of last year as well. To work with existing community groups and theatre groups, just groups within the community, young communities, old communities, people who already have access to the people that you want to reach out to, in a way, so that your information can kind of already go through an established pipeline of people. Transparency also is a major help for young people getting involved. It was a help for me, of just knowing who runs it, why they run it, what it does, what it will do, what it has done, what its purpose is, what they want you to do, and everything kind of set out clear as day. To give training to young people, so young people feel confident after getting involved possibly and everything. So it's just, again, just a very smooth process. To have a key contact just to support young people and to have that regular communication. So for us, it was Fola on the Imperial College team that we kind of looked to as the person who would come and check in with us as well, the person who would introduce us to the researchers and the meet the researchers part, and just kind of just a face and a human being to the kind of nebulous name. So it makes it a bit less mystified. And another top tip for involving young people is to pay young people for their time. So a lot of the time we will be young people, like I said, the invisible community comment will be a lot of young people, underprivileged, working class, who do need to work. And so offering to pay someone for their time makes it way easier for that person to get involved, especially if they really want to get involved, they now can practically. So that kind of, they maybe missed off of a shift at work or anything, then it kind of fills that spot. It fills that little space financially, or it just helps it just helps. It just generally helps engage a young person in general.
So we're actually going to show you a little clip from Jay's project, and we really hope you enjoy it.
And the first step is a change of emphasis that we hope that people will act on this week. We said that you should work from home if you can and only go to work if you must. We now need to stress that anyone who can't work from home, for instance, those in construction or manufacturing, should be actively encouraged to go to work, and we want it to be safe for you to get to work. So you should avoid public transport if at all possible, because we must and will maintain social distancing, and capacity will therefore be limited.
Working from home is a luxury I don't have.
I rang up my work wanting to go back, but they didn't want any high risk of people working.
It's not just as simple as avoid public transport.
The choices that have been made are the ones better for the economy, rather than the ones that are better for the people and for the things that make us feel more human. I can help to kickstart the economy, but I can't see my family and I can't leave the house. I'm fed up, I'm bored.
At present, the worst affected countries are in Europe and North America.
Ready to do normal things again.
Where will my baby go when I go to work?
The COVID-19 pandemic has now spread globally, with nearly 4.2 million cases and 284,000 deaths as of the 11th of May 2020.
Where will I find the money for childcare?
There's lots of questions that people in the NHS or the Public Health Agency or the government want to know.
Where is the humanity?
20 seconds.
We really hope you enjoyed that, and if you want to watch all the other video clips and the rest of Jay's video, we really encourage you to watch them. They're on the links on the screen right now. So yeah, I think we're all proud of our work, and we would love for as many people to see it.
Absolutely.
I think we mentioned that those links will be on Twitter afterwards if you'd like to go and have a look. But that was really amazing. That was very insightful. I'm so glad that you're able to do it all online. That sounds stressful, but I mean, it's all worked out well. So thank you for that. And next up, we do have Lindsay and Lizzie with their COPI study, which is a co-produced mixed method study looking at youth mental health and coping during COVID-19. It's a very important topic, and I'll hand over to you guys.
Hi. So thanks, Nathan. And thank you for everyone for attending today. Obviously, it's been a tough time for everyone since March last year, for both our physical and mental health. Our talk will focus mainly on a mixed method study that was co-produced with myself as a young person and other young people with experience of mental health difficulties.
So COPI was co-produced with young people like Lizzie. So I thought it'd be helpful to introduce what co-production actually is. So co-production is defined as working together in equal partnerships, sharing responsibility and power from the start to the end of a research project. And there's 5 main principles that we adhered to throughout. So sharing power. So the research is jointly owned and people work together to achieve a joint understanding. So we set up a WhatsApp group early on to ensure every decision was made together, including all perspectives and skills. So we made sure the research team includes everyone that can make a contribution, respecting and valuing the knowledge. So everyone was of equal importance. There was no sort of hierarchical construction there. All thoughts about the study were considered and then decided together through a consensus process. Reciprocity, everyone benefits from working together. So for example, the young people were trained in conducting interviews online and analysing those interview transcripts. And they were also trained in mental health first aid. So we built and maintained relationships, and this is the emphasis on relationships is such a key part, and from the start. It really does help to unlock their potential, and we started at the beginning sort of getting to know each other, and it was so crucial in that early stage to make time for that.
So why look at youth mental health? We know that youth mental health was a public health priority even just before the pandemic. 75% of mental health difficulties start before age 24. The period before 24 has key development milestones such as school completion, starting relationships, starting university, and the labour market. When the pandemic occurred during COVID-19, all of these things were disrupted. Young people were a particularly vulnerable group during the public health crisis. Young people's mental health was defined as a priority, and particularly in those who already have had mental health difficulties. There was an early need to see what impact the pandemic had on youth mental health. There were lots of studies conducted mainly online surveys across the world. However, we chose to focus on using innovative methodology to explore youth mental health in depth, and also to work together with the very people the research is about. We knew there was a lack of meaningful patient and public involvement, the PPI co-production, and we wanted to change that. So what did we ask and why? We knew youth mental health was a research priority, but we didn't know which area to examine. Building on the previous work from Young Minds and MQ, we developed 11 research questions and put them to the public. We asked them to decide which question was the most important using a digital card sorting exercise. 78 young people completed the task over one day. One research area was identified as the most important. So we subsequently decided together to complete a mixed method study, both survey and interviews, to examine the mental health status and coping strategies of young people aged 16 to 24 over time. We specifically wanted to describe key characteristics and associations between different mental health statuses, coping strategies, and other factors. One, for example, would be optimism. We also wanted to use the interviews to explore more specific experiences and coping examples during lockdown to help inform policy and practice.
So I appreciate this is quite a complex slide, so I'm just going to go through a little bit. But COPE is essentially split into 3 different studies, and we're going to focus today on COPE 1 primarily. But for COPE 1, we advertised and recruited young people aged 16 to 25, and they completed our survey over a 2-week period in April to May last year. And the survey covered all things that Lizzie's already mentioned, but as well as covered related factors such as self-isolation, access to green space, and where people were living. We then approached a random sample of those who had completed the survey and asked them if they could talk to us further about their experiences. We used the survey results to inform our co-produced topic guide and worked together online to do this. We followed up on those answers in the interview. We then coded interviews and co-produced an initial coding framework and used that to code the rest of the transcripts. We used digital software so that everyone had access to it at the same time and could inform together. So for example, Jamboard was for initial ideas, Trello to present all codes, and Miro to produce the thematic map. All team members had access and ownership of the documents. COPE 2 looked over a period of time from May up until October last year, and we again followed up with some interviews. And then in February this year, we've just done another survey to compare between lockdown 3 and lockdown 1. So what did we actually find out in COPE 1? So around 800 people, so 796 took part in the survey, and a mean age of 19.5. Most were single and stayed at home, and around a quarter were identified as non-white, which is actually overrepresentation of the national population. A fifth had a mental health diagnosis, which included depression and anxiety, and just under a third had self-harmed before lockdown. Around a third had poor mental health, and then we looked at this further and split the group between poor mental health and those who had, well, I guess good mental health as the opposite. People identified as Black British ethnicity had the highest increased odds of experiencing poor mental health, but the the confidence intervals were pretty wide, so we have to take this with caution. But coping strategies such as behavioural disengagement, self-blame and substance use were all sort of higher increased odds of having poor mental health. So as I said before, we use digital technologies to be able to produce this co-produced map, and we did it over 2 or 3 online meetings. And as you can see, that all of the themes are kind of mixed together. So pre-existing and developing helpful coping strategies, for example, so avoidance came through, distraction, keeping to routine. Those with and without a pre-existing mental health difficulty worsened during their lockdown, but others actually thrived. And actually this was in relation to more active coping strategies. If you can see on the sort of the right-hand side, it's more around this maintaining routine that really did come through, and sort of active things like taking the dog out for a walk, or going out and having exercise, and like that. The last sort of theme around the need for mental health and non-mental health support really came through in relation to peer support and digital alternatives to sort of having mental health support access, which was still limited during the lockdown, of course. And we really found that universities and schools were well placed to be able to open up for different workshops on this, and that really was recommended by the young people.
How are young people coping? So we followed up with some of the young people. Our young research partners, such as myself, were trained and we conducted half of the interviews. So here's a few things young people were saying. One of which was, I get to hear their voices and also their expression. It makes me feel less lonely during this lockdown. Another one, since lockdown, I reached out to my university's mental health service, but I haven't had a response, I suppose due to high demand. So I feel like, talking about strengths and limitations, there are several main strengths to our study. A key strength with the study was co-produced. Young people with lived experiences, for example, co-researchers, were involved throughout all the research stages, including analysis and dissemination. Similarly, openness, peer debriefing of both the co-researcher and the researcher, and recorded flexivity of all the research team members also helped to achieve this. Researcher triangulation between the researchers and 3 co-researchers throughout the analysis stage meant findings captured a depth of knowledge in different lived experiences, which enhanced data rigor. There are also limitations. For example, cross-sectional survey means it's hard to determine causality. Self-reported behaviours could therefore be subject to participant reporting bias. Similarly, there may have been research bias, as codes may have been influenced by both researchers, for example, experience in sleep research, and co-research experience, for example, lived experience. Talking about reflections from working on this project. So, for example, I would say that my own personal reflections on working on this project with the team would be that I felt that I could be completely honest. I felt like whatever I had to say was really valued, and I felt really equal. Lindsay, Kat, and Anna were amazing in terms of just making it really welcoming, kind of recruiting, and just making us feel really involved and kind of a safe atmosphere. They were really good with organizing, kind of when we were going to meet, what we were going to do. I felt really kind of reassured and comforted. So I really would say that it was great working with them, and they made the project a lot better.
Sorry, unmute. So we know that patient and public involvement and true co-production has been limited throughout lockdown. So our study, I would say, is quite unique, but co-production is possible despite the pandemic, but innovation is required. So the impact of all COVID-19 lockdowns seem to have worsened people's mental health, but quality social connections with family and partners and friends, and also self-management, and so self-implemented active coping strategies can help mitigate this. The early indication from COPE 2 and 3 are that people are particularly lonely at university as connections have been affected. Therefore, peer support and youth-led services and more general support for youth mental health is needed. Schools and universities are well placed, as I mentioned before, and cheap digital sessions that cover general advice, evidence-based coping strategies, and life skills, as well as signposting, can be suggested and run essentially. We just wanted to finish with some key learning for our co-production sort of work. And hopefully this could be taken forward by everyone else or other people who are interested in this. So, for example, setting up a communication strategy from day dot. We asked the young people what they would prefer, like Lizzie, and everyone was happy with a WhatsApp group. So that really helped to maintain daily communication and decision making. We used this the software was accessible. So for example, Jamboard, everyone could then access it. Everyone had equal responsibility on it and no one owned it. Everyone jointly owned it. Co-researchers were safeguarded. So for example, we had mental health first aid training. We had a clinician or two on board. And also the flip was that the co-researchers had CRB checks, DBS checks, and also they had mental health first aid training. So it sort of worked both ways.
Thank you so much for listening to us this afternoon. Special thanks goes to the rest of our team and all the other young people who took part in the CoPE study during last year. We hope you enjoyed our talk. Thank you very much.
Well, thank you very much to you too. That was very insightful, and I love co-production. I'm sure you'll hear a lot about it today. So we did get a couple of questions. Well, actually, we've got quite a few questions. I'm just trying to waft through them as we go. But I'll put the first one to Jay, if that's okay. I know Rana's had to dip early, unfortunately. But so Jay, what advice would you give to young people who are perhaps sort of more introvert or more shy and a bit anxious about, moving into the acting world and putting themselves out there?
So my main advice for people who are introverted and getting into the acting industry, and to say to other people who are introverted as well, is one, acting is not the only aspect of the acting industry. You can write, you can direct, you can observe, and not every day is a performance. And also, as more of an acting kind of thing, is if you're shy and introverted, which I am very introverted. I have the tiniest social battery you can imagine. But with acting, it's think of it as playing a character, or think of it as you are just channeling someone's writing. So that's what helps me personally deal with it when I'm feeling a bit shy, of just you are playing someone else. So try and play someone confident, and those kind of thoughts help. Usually, not for everyone, but usually help to bleed into your everyday life as well, and they help you. They help you get through social situations. And again, I can't stress enough, you can do other things. You can write, you can direct until you feel comfortable enough to act.
That's great. Thank you very much. I might give it a go myself. But the next question we have, so again, this one's quite a lengthy one, but I think it's for Lindsay and Lizzie. We'll go with, I'll just read it out. It goes, from my experience of young people, generally speaking, they get mental health. They understand it, they recognize it for what it is. They've grown up with it on the agenda as an item, not just of concern, but with respect to stigma and discrimination. So I'd like to ask what challenges they've faced in talking to people who perhaps are lacking in a bit of understanding, maybe even people within their families and friendship groups.
Do you want to take it, Lizzie, or do you want me to?
I can take it. So after reading that question, I thought about it, and considering the other, let's say, like young people around my age, I'm 19 in uni. So I would say that I was kind of surprised when I came to uni that in a good way that mental health was it was a lot more talked about. There's not that much stigma, for example, if like people are on meds for depression or anxiety. Whereas I remember being at school literally 2 years ago, that there'd be a lot of stigma. So I think definitely depends on the specific age group, because I feel like school is more, is a lot more concentrated in terms of that, whereas university tends to be more open. And then, so I feel like, and as you were saying with the other second part of the question, with family and friends that are less understanding, I feel that it would be hard to communicate with them, because I feel like if they aren't understanding, it's usually because they haven't been exposed to maybe the understanding. So it would either be up to themselves as people to try and kind of not educate themselves, but try to grasp a better understanding to helping other people around them. But yeah, that's what I think anyways.
That's amazing. Thank you for sharing that. That's really interesting. I'm sure a lot of people will take something from that. We've got another question, but I think Steph said she'd like to jump in on this one. So I'll just read it out again. I'd be interested in any conversation or information around young people who are in custody, sort of, young offenders institutes or secure children's homes, for example.
Thanks, Nathan. I'm just going to pop on with some resources more than anything. I know that Felicity, Fizz to me, has popped up in the chat with something that Investing in Children are doing. But there has I don't know if anybody was aware, but there was a Inspectorate of Prisons report released this week. It's prisons across the whole, but it includes young offenders as well. And there's actually there's snippets of voice recordings of how people have experienced loneliness, mental health, separation from families. So I'll link to that in the chat. There's also, if you flip the question on its head a little bit, there's also growing work around how the pandemic and the restrictions in the custodial setting are impacting on families. People who have a family member in prison. So Shauna Minson in Oxford does amazing work on that. She's working with me on something else. I'm going to pop this Inspectorate report in, which kickstarts something, and I know that Fizz popped something in the chat a little bit earlier.
Thanks for that, Steph. We're doing amazingly for time, I think, which is rare. So I'll ask one more question if that's all right, and I'll put it out to any of the presenters, because I know Jay, you mentioned sort of digital access and things like that. So the question was, how can we overcome the barriers put in place by digital poverty to make these kinds of activities accessible to all?
You said Jay, that was me.
I think you'd be best placed to answer it. That was just my opinion, but yeah, if you'd like to.
I'm just checking so I don't talk over anyone else. So to tackle digital poverty, I would just say to do just that, to tackle it, to get in touch. I want to put more emphasis on the point before, getting in touch with communities and community projects that are already going for that. But so I don't have a lot of research on it. I don't have a lot of statistics on it, but I can just say a lot of community issues are usually being tackled by someone out there. So it would be to try and find those people and to pour energy and funding and attention into those projects that are already trying to lobby for getting poor kids working connections, working computers, so that they are able to take part in these surveys, even outside of a COVID context, even in a disability context where these people, their whole life means that just being able to take part in things remotely would take off so much strain, so much, it would be safer, be easier, be just more accessible. So, I mean, seek out those communities that already strive for it, pay attention to strides in politics that strive for it, because digital poverty is something that I do actually feel quite strongly about, as I do teach remotely and seeing kids with bad connection and seeing how kids with a lot of passion get messed about because they have been forced to stay home where they don't have a connection, they don't have a working computer, and they can't do what they want to do. So just absolutely seeking out the people that are already tackling it, and if there's no one tackling it, then start tackling it. There's always power in community. There's always power in a bunch of it, because us as a class are fed up of a lot of things, and because of that, those things will band us together. All of us are fed up of not having to work from home, but having to work from home without the resources to do so. So the power in being fed up as a collective can take us quite far.
That's amazing. Thank you for that. A really, really strong message, quite powerful. And yeah, no, we'll move on then. I suppose we're doing well for time again. So we'll start off with Jeremy, who is talking about how we can get back to school safely through the CoMMins project. And there we are. I will hand over.
Jeremy, just as we're handing over, just to flag, I've made all presenters co-hosts. Sure, you should be cool to share your screen.
Right. Hello, I'm Jeremy Horde. I'm from the University of Bristol and also ARC West. And I'm going to be talking to you today about the findings from our back to school study, which we did last summer, but also our CoMMins study, which we're just starting at the moment. So just to start with some context. Last summer, my colleague, Professor Caroline Renton, spoke to our Director of Public Health about what can academics do to help with the crisis? What can we do to help public health departments? And the thing that she said back was basically keep the schools open. The most important thing is, it's going to be a challenging year ahead. How can we keep the schools open? So last June, we got together some academics from across the university and pulled together a grant application for the CoMMins study, which is mapping, so trying to track the COVID infections, but also mitigation. So how can you try and prevent infections in schools? It's the fastest grant application I've ever written, and we were successful, and we got £2.7 million, which is amazing. And so to be able to do this study, we had to start it in September. So again, things have been moving at such a pace. So whilst we were setting up the study, we started doing the back to school study. But I'll start off by saying what the CoMMins study is first. So there's many different work streams from the CoMMins study, and these are some of the main ones. The first one is school testing. And this was before the government brought in school testing. So this was last summer. So this was to test whole schools to find out about infections in schools and how infections are transmitted in schools. Another part of the work was then to map these infections and I'd say if there's hotspots in the city and how can you prevent these infections. Then it was to look at data linkage to see what the impact of these infections, that the impact on COVID on young people is not really understood. So can we look at what's going on there? So that's the mapping side of it. In terms of the mitigation side of it, one thing was looking at infection control. What can we do to try and prevent the infection in schools? And germ defense is a behavior intervention that's already been used in adults that teaches them good hygiene to help prevent infections. So we saw, could we actually adapt this for children and to roll it out in schools? This is happening. Another thing is to look at information systems. So what can help the schools? So do schools need their own test and trace systems? Would that help them work through this? And then the final work stream that I'm working on is student and staff wellbeing. So this is called our School Life During COVID-19 study. And we're interviewing staff and pupils to look at what's the impact of COVID-19 on their well-being in terms of schools. School is now different. They've got all these mitigation measures in place, such as social distancing. So what's the impact on that in terms of school life and the impact on people's mental well-being as well? So this is the study that we're going on at the moment. But to be able to do this, we needed to find out what was happening on the ground and if any of this was actually acceptable as well. So this is why very rapidly last summer, we did the back to school study. Just some background on that. So school closures have happened throughout the world, so 172 countries. And the estimates that it's expected 84% of students, so massive effect globally of schools being closed. In the UK, the schools closed in March and then reopened on the 15th of June for year 10 and 12 students and for primary school students, and then fully reopened in September. And then during the summer, the guidance from the government was to try and do lots of different sort of mitigation measures. So there was creating year bubbles, there was trying to do social distancing, there was improved hand hygiene, using sanitizer, improved cleaning, and trying to isolate symptomatic individuals as well. But little was known about the acceptability and feasibility of these measures. Even though schools were reopening, they weren't opening the same as they were the year before. They were very different. So this is what we tried to look at in the back to school study. So we interviewed school pupils, staff and parents and carers about their views on returning back to school last September. So what did they think about that? Their attitudes towards these infection control measures. Any particular student groups they thought that may be particularly affected by these measures, and their attitudes towards the school-based test and trace. because this was something, we were going to introduce before the government introduced it. So we rapidly did interviews between July and September. I mean, I think it took about 3 weeks between designing the study, getting some money, getting the people together, getting ethics and starting data collection. It's very, very rapid the way we've done this work. We interviewed 15 members of school staff from 7 schools and then 20 families from 10 different schools. And the idea was that we would be rapidly feeding back this information to the local authorities of the schools as we were collecting it, to try and make this as useful as possible to help them plan for reopening schools last September. So what did we find? So in terms of the school risk, how people felt about going back to school during the pandemic. So the perceived impacts of missing learning really outweighed any COVID-19 risks at school. And families were concerned about the negative education consequences of not being at school and accepting that homeschooling couldn't continue forever. Both families and staff raised concerns about vulnerable staff and families due to health, age, or ethnicity, and noting that the lack of scientific understanding around these risks at the time. And these concerns were more common in ethnic minority families. Some teachers did raise concerns about being super spreaders, that they may be going from class to class and they then going back to their families and fearful that they may be passing the infections around. And you can see from both of these quotes, there's sort of a resigned acceptance that if you want pupils back at school, you've got to accept some risks. So both from a parent and from a teacher in this case. So what did people think about in the infection control measures? So the interviews highlighted that there was a really wide variety of COVID-19 infection control measures. So year bubbles, using hand sanitizer everywhere, social distancing. And participants agreed that such measures were needed, although staff were frustrated by the lack of government detail and that they had to make up their own plans. There wasn't really clear guidance of what they should be doing. These measures were seen as a pragmatic solution, but all participants agreed that social distancing in school was going to be pretty impossible, given the number of people and the lack of space. And you can see from these quotes, there's a pupil wondering if the school will have a magical plan, and the teacher saying that it's a lot of that'll do, that'll do. So being, really pragmatic, but accepting there's going to be some risks from schools reopening. In terms of concerns about these measures, an important concern for staff was the impact of these measures on learning and also pastoral care. So particularly for students with special educational needs or mental health issues, and particularly around social distancing, which meant that the teacher has to stay at the front of the class rather than interacting with the students and actually going up to a student's desk. And as this quote demonstrates, it's those students that are going to miss out are the ones that wouldn't normally put their hand up. So maybe those that need the most help may not be getting the most help as well. So this really demonstrates that there's a need for tailored support for vulnerable students and those with additional needs. And schools and policymakers need to think about the potential unintended consequences of these mitigation measures, ways to support vulnerable pupils, and how to avoid deepening inequalities that may already be existing already. In terms of what help students abide by the rules of the school, participants really suggested that it's clear and consistent information and reminders that engender a sense of collective responsibility to help students follow these control measures. This includes the importance of emphasizing that the social good of following these measures, the benefits to students, their families, and the wider community. So a sense of collective identity and responsibility. So very much a carrot rather than a stick. And you can see here that this teacher is talking about emphasizing the common good, that we're doing this for everyone by following these rules. Now, these findings have an important implications for policymakers and for schools. So clear, consistent information is needed from both the government and from schools, and creating this sense of collective responsibility in trying to prevent, stigma related to COVID-19 infections as well. That we're, to do a government phrase, we're all in this together. Now, what do people think about school testing? The majority of participants welcomed the COVID-19 testing in schools to reassure staff, pupils, and parents about the school's safety and to encourage attendance and potentially reduce the need for school closures. And stigma related to COVID-19 positive tests was thought unlikely to be widespread as well. From both pupils and staff and parents, they thought that people do understand what's going on at the moment. There were a small number of concerns related to data security around anonymity, and if you're getting a positive test. There was also concerns about more school closures if there's positive test results, and the practical aspects of testing. So finding the time to do it, the space to do it, and administering those tests. And you can see here that a pupil in this quote is quite happy to be tested, but a mother feels uncomfortable about data being collected about their child. So it's really trying to roll out testing in a very sensitive way. So in terms of our conclusions, so that the concerns about COVID-19 risks were really outweighed by the impact of missing learning. The schools were left to develop their own infection control plans because at the time there was really unclear government guidance and they had to do this very quickly over the summer. Infection control measures were acceptable and a pragmatic solution, but there was this real feeling that social distancing was going to be impossible in the schools because of such crowded schools. So these findings support extra funding for schools to bring in these COVID-19 infection control measures. So more money for hand sanitizers. People were talking about up to £40,000 in hand sanitizer and extra cleaning that the schools have got to find. Get free face masks for students was important. Improving ventilation, that making sure that windows can actually open in classrooms. There's also in high prevalence areas the idea of hiring extra teachers and extra teaching rooms so you can have small class sizes and to allow social distancing as well. Also that to encourage students to follow these infection control measures, it's really about emphasizing the social goods, the benefits, and also this collective identity and responsibility. And these are much more effective than punishment. So a carrot rather than the stick. And if implemented sensitively, COVID-19 testing was seen as a good thing by the pupils, by the parents, and by the teachers as well. And they thought this may actually, encourage attendance and reduce closures. But all of these measures, there were concerns about if they were going to widen educational and health inequalities. And you've really got to think about who are the most vulnerable students that the unintended consequences are really going to impact for these measures. And can you actually provide additional support for these students? In terms of the impact from the study, so a couple of weeks ago, we've had a paper published in BMJ Pediatrics Open. And when I stop sharing, I'll share a link to that. We produced 2 rapid reports that went to the local authorities and to the schools to help them open up their schools. We've presented our findings to the Department of Education. We've submitted our findings to 2 parliamentary inquiries as well about COVID and education. And we've disseminated our findings to SPI-B, which is the Behavioural Subcommittee of SAGE, Public Health England Behavioural Science Cell, and local authorities in the region to try and get the most impact out of this work. And I'd just like to thank everyone that took part in the study, and particularly the community groups that really engaged during the summer to try and help recruit the participants. And it's not just me in the study, there's a whole study team which collected the data, and there's the reference to our paper. Also, in terms of our CoMMins study, so I'm doing that with Sabby Redwood, Sarah Bell, and Jane Williams at the moment. And Sarah and Jane have started collecting data and done interviews with staff, and we're just about to start some interviews with pupils as well. So hopefully if we do this again, we'll be able to present some findings from that study. Thank you.
Thanks for that, Jeremy. That was great. I love the notion of sort of tailored considerations and tailored measures. And I also love the fact that even, with something as important as infection control, young people's well-being and their voices are still, being considered also. So we have some great questions there, but we'll move to those after the next presentation, which, following quite nicely, is on the impact. No, sorry, it's on making children's voices count in policy by Liz and Luke. So take it away.
Hello, everybody. Really, thank you very much for this amazing set of presentations. Really happy to be here. So I'm Liz Todd. I'm just finding to share my screen here. Hold on a minute. Here we go. Okay. Okay. And Luke, you're here, I hope.
I'm here as well. Hi, everyone. My name's Luke Bramble. I'm the Poverty Proofing and Participation Service Manager at regional charity called Children North East. So, Liz, do you want to do your full introduction and then I'll make a start?
Yes, I'm Liz Todd and I'm the Professor of Education and Inclusion at Newcastle University.
Fantastic, excellent. And just to echo what Liz has just said, fantastic presentation so far, really insightful stuff. I've already been making notes to take back to our kind of project team on this project, so that, in terms of some learning that we can move forward. So, so this is a bit of an outline of what we're going to be spending the next 15 minutes doing, and we are going to jump from myself to Liz, to me, to Liz, etc., etc. You get the message. So, so hopefully it won't be too discombobulating, but will be useful and insightful and helpful. So, so I'm going to kick off just giving an overview about how the project came about. So, I guess just in terms of context, Liz and her wonderful work at Newcastle University and the team that she worked with have been kind of engaged with us as a charity. We are a regional charity, Children North East, and doing some great work around, particularly around poverty proofing. And we had this kind of pre-existing relationship between the two organisations. We hark back to a year or just short of a year ago now, and what very much, certainly from my perspective, I was finding was there was a lot of conversations that I was part of, in the VCS sector, and we were talking about, we're going to have to make sure that we respond to children and young people and make sure that there is enough support there for those children and young people, and children and young people may be struggling with anxiety and desocialization, all these kind of really big things. And I'm thinking, and I was guilty of it myself, saying, yeah, no, that's right, we do. But it was this kind of moment of, do you know what, that's all very well as saying that, but most importantly, we need to make sure that we're on point here. We need to be speaking to children and young people and helping them, not just helping them, but in such a way that they can shape our response, and not just me as a voluntary organisation, but actually across all different sectors that work together to support children and young people. I mean, across our region and nationally. So Liz and I, picked up this conversation, and we both very much kind of felt strongly that we needed to kind of make sure that we had some kind of engagement with children and young people. We embarked upon a process of kind of developing a methodology, and Liz is going to talk about that shortly. But it was about how can we engage children and young people in such a way that they are able to really kind of lead our change, lead this recovery that we're now, that's the key word, isn't it, at the minute? How can we can lead this recovery as we move forward? And we just started doing some consultation because we knew it was so valuable and so needed, and eventually got to a point where we put in a bid. I mean, if you like, a tentative bid, but we want a bid to get some funding to really delve into this world because it was so vital and so important. And we started the work, we started getting some findings and analysing those, and again we'll come on to those kind of some of the early findings shortly. But back in October we heard the great news that we were being funded by the Economic and Social Research Council. I had to write that one down. to actually carry out this research. And there was something that was of particular concern to us, and it was that it's important that children and young people drive this, but we were particularly concerned about those children and young people who, on top of COVID, on top of this kind of this strange world and environment that we've all been living in for the last year, but those children and young people that were also suffering the effects of poverty on a day-by-day basis. And we wanted to make sure that their voice was amplified and heard, so that the response to COVID could be on point and really be impactful. Liz, can I hand over to you on that one? Is this a good point?
Yes, it's a very good point. So thank you, Luke. So I'm hoping you're getting the picture that this is a completely co-produced project by Newcastle University and the charity Children North East. So we have researchers in both organisations working together, and Luke's going to tell you about how we did that a bit later. And it's not completely co-produced with young people, but it is very much with young people, and I'll explain a bit about that as well as we go on. It's a broad consultation with 1,500 children and young people about their current experiences of life, focusing on children and young people who are economically disadvantaged. And it involves targeted interviews with 500 of them, but we're going to try and make that 1,000. And then we're going to follow that up with working with organisations and schools with the leads, and involving those organisations in making some change, because we're not interested just in finding out what young people think, but we're interested in getting that information quickly to people who are making the decisions, because we think people are making decisions now about what children need and the kinds of lives they want to live and the sort of services they need as a result of that. But we really want the information from young people to feed into them as they are making that, and to try and make that happen. And again, Luke's going to talk about that a bit later. So what we've actually done, the methodology we came up with, and we did start to think whether we would do an online one. We thought whether we would get young people to feed back to us in a digital form. Anyway, what we came up with was a kind of two-stage process. And one was to go along with the fact that Children North East, the charity, were delivering resource packs to a large number of young people across the whole of the North East and to their families. And we thought we could put a research pack into that resource pack. So what we did was we designed a research pack that had the opportunity of writing or drawing the answers to 3 questions. What's been a challenge recently? What's been good recently? And what's been important to young people? And we've got some lovely drawings and responses back to that. I think we've put out about 1,600 of these kind of packs at the moment. We also said we've been starting to do this as well. In fact, we started even before we had the funding to do online or face-to-face, whatever we're allowed or permitted to do, focus groups with children and young people aged 5 to 18 in the 12 regional authorities. And also central to this, because children's voices are, and what children think is completely at the centre of what we want to do, we are consulting with children and young people when we can about the methods. So North Tyneside Youth Council have been consulted about how we've done this, what do they think? And we're now consulting with other young people, other groups, as we're starting to take our findings into organisations such as transport. So young people are going to be talking to the transport providers. We're going to be developing comics and videos later on to reflect our findings, but that's going to be co-produced completely with young people, reflecting what they want to say about those particular areas that they want to talk about. And we've got policy and practice events planned as well. Just one thing to say about the methods as well is that we have a focus on disadvantage, but we've taken an ethical decision, a particular policy decision, not to ask people about their economic circumstances. And that provides a bit of a kind of, okay, so how do you do this? How do you actually target your research? So what we're doing is we're targeting as much as we can to areas and to schools and to groups that we know have a majority of economically disadvantaged young people and families. But we don't want people to feel stigmatized, and it's part of our experience of poverty proofing schools that we shouldn't be actually asking those questions. I think that's all I want to say on method. I'm just going to quickly check my, yeah, so it's the other thing to say about methods, checking my notes, is that we're very much cognizant that children and young people's experiences are changing. And I mean, our experience of this research and methodologically has been massive challenges when anything different happens. So when there's been a lockdown or when there's been some sort of releasing of the restrictions, whatever the change has been, it's quite a big transition for everybody, for our research, but also for young people. And so we're researching in those different phases of the lockdown, and we've so far got data from the first phase when there was the first lockdown and the first going back to school, and we've now got data from the lockdown that we're hopefully starting to come out of. Okay, I think it's over to you now, Luke.
Great, thanks, Liz. So I guess there's something about that you know, we're just about to come onto the kind of the real meat, which is all about, you know, well, what have we found and what are children and young people telling us right now, right here, and how we're responding to it. But there's something that's really interesting for us, and actually I think really valuable for us to be wary of as we move forward, or not wary of, but aware of, which is how we work together in such a way that is truly effective and truly collaborative. And so actually we've got, you know, the team from Children North East and the team from Newcastle University. We meet regularly every Friday morning. We have an hour and a half. If we can, you know, rein ourselves in anyway, because we've got so much to say, all this really valuable information coming from children and young people, and those conversations are so vital in terms of us getting to a point where we really have that robust understanding of actually what's this holistic kind of view from children and young people, and how can we respond. So it's also at those operational working groups that we develop the delivery model. As Liz said, this isn't about a one point in time, and one thing that we didn't want to do was just stop with a group, speak to a group and that's it. You know, there's something of the journey, and that's why we've set this up in such a way that we can reflect the journey. And if we were here in 6 months' time, you never know, maybe we will be. And then actually we'll have a series of different groups of young people that have engaged in some of these issues that really matter to them. And I truly believe we can make, you know, we can work in such a way that that's meant, you know, significant change for the good, for the lives of children and young people in the recovery. We've had specific subgroups, and actually just something really kind of fascinating just about the way that you work across organizations, the ability to have kind of online space to put things, the way that we have to communicate all that bit more. You know, we will, you know, at the end of this process, if indeed it ends, you know, we're actually quite passionate that it doesn't, because we always need to hear the voices of and experiences of children and young people, and that should always dictate policy, I believe. But actually, there's something about, you know, this way of working, and it's been really valuable. So I think it's really important to share that. But let's come on to kind of some of the meat, which is, you know, well, what is it that we found so far? So I'll hand back to Liz.
Okay, so I'm going to tell you some of the main things we found, but this list here are the things we asked about. So the first point to say is that we have found an awful lot about children's health and mental health and well-being. But actually, that's because we've asked about all these different areas, and we've also tried to be open to what young people want to talk to us about. So in the focus groups, of course, you can't, in the half an hour, maximum an hour that you have in those kind of groups, ask about absolutely every one of these. So different groups are asked about different things, and it depends on the interest of that group, what ends up being discussed. But we've tried to remain really open to the different kinds of things that people want to spend more time talking about. And so far we've spoken to a report's about to come out on our initial 200 young people, which was in the first, that was before Christmas, and then we've spoken to about the same number of young people since then that we now have to analyse. But what we found in those initial findings before Christmas, and I'll add in bits of things from the most recent ones, but so I'm not going to do it per theme here. I'm just going to tell you the kind of main findings. So young people have been largely positive about return to school, particularly to see friends, and people wouldn't be surprised by that. But they've been largely negative about the experience of online learning. And I'd like to call this not online home learning or home teaching or any of that, because actually home teaching and home learning is something very different. This is emergency learning and emergency teaching. It's a different kind of thing. Let's be clear about that. But some young people have actually enjoyed being at home and not having to go to school, and they've said why they've named a number of things as to why that was. There's been many online learning problems for young people, particularly the group of young people that we've been talking to. It's not just been not having a particular device. It's been being given devices from schools that didn't work, giving devices at schools without proper instructions, the concerns of families about using them, not having Wi-Fi. There's a whole range of different quite complex problems. And I think I'm, like a previous speaker, really passionate about this, and it's really not addressed. We just haven't even started to properly address this. And just by giving a few devices to schools has not addressed this problem at all. There's a really interesting thing in that the measures taken to schools have been generally accepted by young people, but have also caused stress. But we've also noticed that children have had to deal with continual change, continual transition from one thing to another, that every time they go back to school, something's different. They might even have a different teacher, they're in a different bubble, there's different rules. And we heard that from the last speaker. Continual changes. So in some ways, children are being incredibly resilient, the way that they're managing to deal with this, but let's recognize how well they're doing in having to deal with this. In terms of the rules, they've been incredibly, the young people have been reported to us how rule following they've been, the things they haven't done, what the sacrifices that they've made, and their real irritation with the people who haven't followed the rules. And also their irritation and frustration with the inconsistencies in the rules. Like, I'm with somebody in the classroom, but then I might be on the bus with them, or then I can't be on the bus with them because I have to be on a different bubble, and then I can't see them after school. So all those kind of problems. Young people have missed real milestones. They've missed saying goodbye to teachers. They've missed the transition from primary to secondary. So that's been a big problem for them. They've actually really liked online gaming and the real opportunity to do online gaming. This finding isn't actually welcomed by a lot of people, but I think we've got to embrace that and accept that. That's what young people are telling us. They've loved having that time. TikTok, YouTube, social media platforms. There was an overwhelming wish to see family and friends face to face, and we wouldn't be surprised at that one. Young people have been largely negative about the impact on their physical health and their eating habits, and on a minority on their sleep. But a minority of young people have found it a good thing. They found that their health and health opportunities and opportunities to eat healthily has improved. But there's overwhelming worry, worry about who's going to get COVID, whether they're going to pass it on from the school. So this whole kind of massive thing about worry. Young people have been learning new things at home from all different economic areas, and that's been of welcome to some of them. However, most of their cultural and leisure activities have been curtailed, as we obviously know. One area that we found overwhelming negativity from young people has been about transport. And we've been meeting with the transport providers, but Luke's going to talk about impact in a minute. And universal anxiety about traveling on public transport, and real worries about that. And young people not being allowed to get on buses, and worried about getting the next bus because only 4 people can get on, and so the next one isn't for an hour. Told they can't get on the bus because they haven't got their mask, and so so there's a range of sort of worries about that, which is a real shame, because young people are also telling us how important public transport was to them before pre-COVID. Older children and young people. So I'm almost finished. This is my last main point. Older children and young people have had concerns about their future and their employment and their prospects, and also about the employment of their parents. And the other main issue to point to make about the findings is that if we add to what we're finding here, one thing is that across young people of whatever economic level, young people are saying that generally the same thing. So the general kind of feelings and what people are experiencing, pretty similar. However, the impact on them and what they're able to do to ameliorate that is very different, depending on if you're living in poverty or if you're not. Okay, Luke, over to you.
Great, thank you, Liz. So lots of really fascinating kind of impact there, fascinating findings there. Essentially, as Liz highlighted, we're at the end of kind of analysing the first kind of round of kind of information that's come out, data, if you like, that's come our way. And we have developed an advisory group. As I said earlier, the point of this project is for this to have impact. It's not just that, it's important to hear the views, but actually we need to make sure that goes places and that information is shared. So we initially set up an advisory group. This is a cross-sector group of organisations, both regionally, and we do have a northeast kind of focus. but also nationally, because we also have a national focus and we want to share these findings far and wide. It's very important. So to bring people together to help us direct, actually, look, these things are coming up. How do we address them? How do we make sure that this has, move somewhere? And I guess this is another thing. It's that bottom kind of sentence on the screen there. What's the barriers for your sector's engagement? So what's the routes to share this information? But what are the barriers? Let's really do this kind of in a meaningful way. So the advisory group is really important. And actually also the wider awareness of our findings is important, and we're starting to get some some press coverage, and I say that because that's actually really important in terms of there's something about momentum here, and actually what we want to enable is a momentum that allows people and sectors to see this and think, actually we need to respond to this is vital, and really get that kind of message hammered home. So there's 3 core areas that we focused on off the back of the initial findings that we are really moving forward on. The first that came through that Liz highlighted was that social interaction, that desire for social interaction. So we're working with the North East Culture Bridge, with Schools North East, and with a few other organisations to bring together best practice. This is a message that needs to go out right now. It's no good telling people this in 3 months, 6 months time. Right now, children and young people desire to do face-to-face things. They desire that social interaction. What we need to be sharing is good practice on how that's able and how that's effective, whether that be within schools, cultural organisations, charities, a wide variety of different organisations. We need to consider that. So we're going to bring together some good examples of that and share that. So second area that we're looking at is around the employment. So older young people, as they said, really worried about their future employment. So we are working with the North East Chamber of Commerce, with a number of larger businesses, and what we're doing is we're going to be bringing some of those groups that really highlighted that issue and led us down that track, really, and how we're really passionate about that, together with those business leaders and with the local Chamber of Commerce, to share that. If you're 17 years old and you're feeling really nervous, about your future and future employment opportunities, there might be all this work going on over here, but if you don't know about it, you're still going to be nervous and anxious about what's to come. So it's about bringing the young people to really share their experiences and ask for a response, and that's coming up in the coming month. And the final thing, which Liz alluded to, because this kind of journey is really getting going, which is working with local public transport providers. And we had a number of key individuals, MDs and leaders of kind of public transport providers, particularly around the North East, to share initial kind of findings around what the concerns are. And again, we've had commitment there that they are going to meet with some groups of young people and give a response. So we're at the first stage of that journey. We have got the right people in the room, we believe, and now we need to, we've got groups of young people that we're working with who are going to go and say, right, what are you going to do for us, kind of thing, So I think there's something of that process which is really powerful. Stressed before and we'll stress again. The key thing here is about real impact and that voice having impact. I'll hand back to Liz to wrap up and talk about next steps.
Okay, so I'm just gonna really give you some reflections on what we've been doing together and how it's been going. So this is being an amazing project. Absolutely, just amazing hearing what young people have to say and trying to have some kind of impact at the moment. It's incredibly challenging as well. It's incredibly challenging. It's wonderful working with Children North East and teasing out the methodology together and all the developments. The kind of trying to work out how are we going to do our online, what kind of ethical approaches are we going to use, and exactly how are we going to do those online focus groups. But what's challenging is that things change all the time, and we're having to be incredibly flexible the whole time. Every time something changes, every time there's a lockdown or something else happens or schools go back and there's less, things are loosening up, we find that our previously assumed access to the young people we were going to be talking to changes again. and we often have to rewrite it right from the very beginning. We're all very well, we're very well networked, both of us. And so our original networks, people are saying, oh yeah, well, I'm really, really sorry, we just can't, it's just like really hard, and we're so sorry. And we know, you know, so some of our closest partners we have to kind of keep a distance from, and then we have to find other things. So we maybe have to go to a teacher conference, online conference, and present what we're doing, and then we find that there are people we've never heard of are massively keen on having us. But we're having to remake these routes, these kind of ways in to get to the young people we want to, because we also really want to get to talk to young people of different groups, of looked after, young people who are excluded, even excluded from the schools that aren't running. They're excluded from, you know, so we want to teach, we want to talk to all kinds of groups of young people and try to really get their views. And that's been very sort of, I mean, but equal measures, amazing and stressful and challenging, but wonderful. So there's been the other thing I suppose I want to say is two things. One is that this is founded on the good relationships between us all, and that's helped us to support each other and keep us creative. And the other thing is I've been very surprised and delighted by the willingness of service providers and youth organisations to work with us, both in data collection and impact. Okay, thank you very much, and over to Nathan.
Oh, thank you for that, Liz. That was really insightful. I've loved that, you know, the variations, very interesting. And I love your focus on sort of dissemination and, you know, putting things where they needed to be. But I will, you know, I've got a couple of questions to go through, and I'd just like to remind everyone that, you know, your questions will get asked. We do have a Q&A. I think it's about 3:45-ish, but we'll be going for a break soon. So I'm just going to randomly pick one here. Okay, I've got one for Jeremy. I think Steph's trying to get a bit of a sneak peek. So we've got, I wonder whether you could tell us anything early coming from the CoMMins conversations with professionals.
Yeah, before I do that, I'll put in the chat, there's the findings of our back to school study, and there's a link to the paper there. In terms of what we're finding from the speaking to teachers in the CoMMins study, we've only done 5 interviews so far, so this is all, you know, not well analysed or anything at all. But I think it's really the fact that schools there's been a lot of innovation. You know, they've been really adaptable and really good problem solvers, and had to work incredibly fast and very quickly to do this. So that's been really amazing. And there's been a real sense of sort of collective endeavour as well. So you know, the schools pulling together to make this happen, and putting together with the pupils and the families as well, the whole thing. But there's also, you know, the burden of this. So the teachers are already, you know, trying to educate the kids. They've got safeguarding issues they've got to deal with. They've got mental health issues they've got to deal with. And now they've got to deal with these health issues as well. So it's just one more thing. And inequalities, you know, is still going to be the big thing that's the real problem. And there's been big inequalities in terms of education, but inequalities in terms of socialization as well. And those are going to have big impacts.
That's really interesting. Great answer. This next session is going to be a quick 20 minutes, to be very, very fast paced. So maybe if you've had some coffee in you might be able to your attention levels might be at an all-time high, and hopefully they are. So we'll start with Harriet, who is looking at the response of youth organisations to COVID and how we can support vulnerable young people during the pandemic and beyond. So I will pass it over to you, Harriet.
Thank you, everyone, and thank you for inviting me here. If you just give me a moment just to figure out how to set this up. Okay, great, here we go. So I haven't got very long, so I'm just going to whiz through these slides, and it's about a study that I've carried out, which was finding out how youth services have adapted during the pandemic to help support vulnerable young people. So youth organisations, they offer vital services for young people, and especially they often work with young people who may not like going to school very often, or may not go to school very often, or have kind of troubled home lives. And the support that youth organisations give to particularly these young people is really important. Because of all the lockdown restrictions we've been living under for the past year, youth organisations haven't been able to deliver their services as they usually would. And this was quite concerning for me, because I thought actually, you know, during these periods of lockdown is actually when young people need more support. So I was interested to find out really what youth organisations had been able to do to help support young people. So the aim of the study was to examine how the COVID-19 pandemic affected the services that were delivered, and we contacted 3 youth organisations in Bristol that I've worked with on previous research projects, and we carried out a qualitative study to explore this. So in October and November, we carried out interviews with staff members and volunteers at the different organisations, and also I did interviews with young people aged 12 to 18 who access the services at each of the organisations. I used thematic analysis to carry out my analyses. So a very brief overview of the results. So we've found all 3 organisations very quickly. They adapted to keep contact with young people during lockdown. And they did that by switching to digital platforms, and they use that for lots of different reasons, either for kind of group activities or one-to-one sessions, either mentoring or kind of job searching, depending on the organisation. And this worked pretty well for a lot of young people, but there were some young people who either they didn't like it or they weren't able, perhaps because they had limited digital access, to join in on these digital platforms. And the youth organisations, where they could, they would ring these young people by phone instead if that worked better. But unfortunately, some young people just kind of disappeared during these periods of lockdown. What became quite apparent during talking to the young people was that they often, without me kind of asking them, they often talked about these really great relationships they had with their youth workers. And that was really important during lockdown. So these kind of trusted relationships that they'd developed before were really helpful. So we've got this young woman who was talking about how, she was struggling quite a lot at the beginning of lockdown, but because she was able to call her youth worker and talk it through, it would kind of make her feel more relaxed and kind of know what she needed to do, and kind of get her through some kind of pretty difficult times for her. So as we've kind of heard in our speakers earlier, both the youth workers and also the young people themselves really missed being able to interact face-to-face with their friends and with the youth workers. So as the restrictions were lifted, young people really valued being able to come back to the youth centre and kind of hang out with their friends and do the different activities. And lots of the youth workers kind of talked about really hoping that we wouldn't go back into another period of lockdown and having to go back onto Zoom or whatever platform they used. And these interviews took place just before the second lockdown was announced. What I also found, which I thought was really interesting, was that not only did young people the youth organisations help support the young people, but they were also very involved in local initiatives to help support local communities. So these could be kind of increasing digital access for young people who may not have Wi-Fi at home or may not have like a phone which they could use to or kind of data on their phone. And all of the youth organisations as well were involved in kind of food drop-offs to kind of families that they knew would benefit from them. So we have this young man who kind of talks about how appreciative he was of the efforts that the youth workers went to make sure that they had this drop-off every so often. So he says his youth worker was bringing it every week, and it was a good amount of food, so it was really good and helpful for his mum, because sometimes they were struggling for money for food. So that drop would come, and that would make sure they were okay. So hopefully, I'm not sure how long that took, but hopefully I'm still within time. So what we found from this study was that youth organisations, despite the lockdown, they continued to play an important role supporting both young people and the wider community. And I really want to use this as a bit of a plug to kind of call out to people who are kind of in charge of funding to really kind of make sure that we do have more funding available to help support young people going forwards, because we know that the kind of impact of this pandemic is, going to be impacting young people for a long time to come, even after restrictions are lifted completely. So thank you all for listening, and I'll pass it on to the co-host.
Thank you very much. No, that was really insightful. And funders, get your wallets out. It's really encouraging to see how people are adapting and helping each other out during these, strange times. But in the interest of time, I will pass on to Maureen, who is going to talk about the impact of COVID-19 on families, children, and young people.
Thank you. I'm just going to try and share my screen. Sorry, you've got 5 minutes. Even a slight technological delay can mess things up. Okay, I will try and keep to time as best I can. So just to very quickly explain who we are and what we do, Children's Neighbourhoods Scotland is based at the University of Glasgow. We're funded by the Scottish Government as part of their Child Poverty Delivery Plan. We are a combined research and delivery programme, so we have community development workers in each of our areas. So we have 6 neighbourhoods and a community development worker in each. We have a small research team, which I'm part of, that works across all sites. Participatory work with children and young people is our core research activity. We use the capabilities approach to develop wellbeing frameworks where young people identify areas they want to see changes in their schools, their communities, their own lives, and look at how they can be supported to take action for change around these issues. Trying to change the next one. So, like many research projects, we had to quickly rethink what was possible when lockdown hit. We were no longer able to continue what we did. We used to work in small groups with primary school age children in schools, and that was obviously no longer possible. And there were just too many practical and ethical issues with us to move that into a kind of digital form. So we took the opportunity, based on relationships we had with third sector and public sector workers, to do some research on their experiences of their kind of frontline work with families in Glasgow, and how services were mobilising to support families through the crisis. So we had 2 local authorities involved in the study, Glasgow being one of them, and that's what I'll talk about today, and a separate study on refugee and migrant families, which was also from Glasgow. So we did, through this work, produce some policy and practice briefings, which we sort of sent out as kind of quick-fire emerging findings to local and national governments to try and help inform their policy responses to the pandemic. So on to the first key finding, which unsurprisingly was the financial impact of the pandemic. This quote highlights that, as well as the high numbers of people already living in poverty in Glasgow, and I should have mentioned the neighbourhoods we work in are all high poverty neighbourhoods. There were many cases of families who were previously just coping, but through loss of income and associated financial increased costs of the pandemic were suddenly plunged into poverty. And for some of them, that was the first time they were experiencing that. Related to this was the issue of housing inequalities, and that was one of the biggest issues for families in Glasgow. The quote here points to the isolation of lockdown, which I think most people can relate to, but this is obviously exacerbated depending on your living situation. When you live in a flat, which 70% of Glaswegians, including myself, do, most people have no access to private outdoor space, and often, particularly families that in our neighbourhoods, didn't have enough space indoors for families to live, learn and work from home together. So that was a real challenge. This has obviously come up today already, but unsurprisingly, digital exclusion and barriers to learning at home. Like many other cities, digital exclusion emerged as one of the key issues for young people in Glasgow. And the quote here refers to an assumption that children and young people, by schools and the local authority, that young people would be able to quite easily access learning digitally, and it became apparent that that was not the case. When the local authority did eventually roll out devices to families, there was still a huge issue, and still is a huge issue, around broadband access, and none of that has been resolved. So that's obviously been a huge barrier to learning for young people. But of course, certain groups of young people had additional challenges. So one of our interviewees spoke of families she supported with children with additional support needs. in this example, in this quote, the impact of the loss of routine and the loss of face-to-face contact with services was really profound for this child and his family. The child simply could not understand why his world had been turned upside down, and it had a huge impact on him, but also his older sibling, who was obviously at home as were parents, so trying to work and study with none of the usual support that they had come to rely on over the past few years. And another group that came up, particularly in the strands of research, which is actually why we chose to do a separate piece of work on refugee and migrant families, was the really challenging experience for particularly vulnerable migrant families in Glasgow. Higher pre-existing poverty levels meant they were particularly vulnerable to the economic impacts. As this quote illustrates, they were already on the margins of society in terms of how much money they had, how much access to services. They were more likely to live in substandard or overcrowded housing, often relying on either, on the one hand, the unregulated private sector housing, private rental sector, or on the other, the Home Office supplied contracted asylum accommodation. And I think the social isolation that everyone experienced during lockdown had additional complications for people who were relatively new in the country. It really disrupted the integration process, and children who were beginning to make friends and learn the language had that quite significantly halted. Some of the interviews also spoke about the impact of that loss of routine in terms of removing the coping mechanisms that people had come to rely on to help sort of process some of the trauma that they'd experienced previously. And a final point there about misinformation, a lot of language barriers and public health information and guidance not being translated quickly enough. And so people's knowledge of what to do and what not to do was often, there was a catch up that youth organisations and community organisations had to fill that gap. But until that gap was filled, there was a lot of sort of stereotyping of groups as gathering outdoors in large groups when they weren't supposed to, and a lot of backlash there. And I think just this final quote here on young asylum seekers, I think encapsulates how the most marginalised young people experience significant harm during lockdown. I mean, this quote refers to the issue of asylum seekers being moved from their flats and into hotels in Glasgow. I'm not sure how aware people are of these issues, but the impact that this had on the mental health of some of the really young people, teenagers who were involved in this. And I think that's something that's going to be a huge concern for organisations to try and support young asylum seekers through this in the coming months and years. So to finish, a few points. I think there's overwhelming evidence that government action is needed in Scottish and UK governments to respond to mitigate the increased financial insecurity of families. There needs to be huge housing reforms. There needs to be opportunities for people with lived experience of poverty to be involved in shaping changes and developing new initiatives. And echoing the point in the last presentation, recognising and valuing the contribution of the third sector, including youth organisations who in our communities did an incredible job to support young people and families, and reallocating public resources to sustain local organisations and move away from this really unstable kind of grant situation that they has become entrenched in the sector. So I'm hoping I kept the time there, and I will finish up. Thank you.
Thank you very much, Maureen. That was, again, really, really interesting. I think you showed really the depth and the scale of some of the issues that we face collectively. And, you know, I can probably relate, I'm sure most young people can, to the notion of sort of feeling trapped and things like that. So but I suppose that ties in nicely to our next one, which is from Emily, and it's talking about the trajectories of young people's mental health and social connectedness during the COVID-19 pandemic.
Thank you. Hi, everyone. I've also been frantically scribbling notes down, so there's been loads of interesting points raised already. So yeah, I'll jump straight in as I've challenged myself to describe graphs in 5 minutes. So the study overview, this is a survey as well as some interviews and focus groups I've been doing this year. The survey quite neatly mapped onto before the pandemic, during the first lockdown, and back to school. So the first survey was October 2019, then during the first lockdown in May, and then when students had recently kind of gone back to school for the first time in October. So I'm going to focus this specifically on anxiety. We did look at depression and wellbeing, but for the purposes of time, and also some interesting findings about how connected young people felt to school and peers. So the first graph actually slightly different from the overall findings, but we actually found a small decrease in anxiety in teenagers during that first lockdown. And I would note this was year 9s, so they were in year 9 at the time, and I've heard lots about the different impacts of different age groups. So year 9s weren't facing exams, for example, so perhaps didn't have that exam pressure there. I've mapped girls and boys as well. Not surprisingly, girls generally report higher level of anxiety, but we see the same trend for both girls and boys. So that slight dip and then an increase in anxiety when they first return to school, which I'll talk about a bit later on as well. So really interesting finding that we found was we split the anxiety by how kind of connected young people felt to school. And I'm just going to draw your attention to the green line. So that's students that felt the least connected to school before the pandemic. And what we actually see is their anxiety levels improve the most. So their anxiety dropped the most. And as you can see, they saw the biggest spike. So we've got this kind of trough effect for all the groups, but it's most pronounced for those that didn't feel connected to school before the pandemic. So I guess these findings are focusing in on a bit more on students that don't particularly like going to school or have perhaps challenging peer relationships. And we also saw exactly the same for peer connectedness, so the same pattern. So those that reported feeling least connected to their peers before the pandemic saw that kind of decrease in anxiety when the schools closed and they were at home. And perhaps again, not surprisingly, if they're having challenging relationships or experiencing bullying. And so this year, the joys of how fast things are moving and also longitudinal studies, these students I've been talking to, they were in year 9, but they're now in year 10. So they will now be facing exams and uncertainty. But as has already been mentioned, probably the most overwhelming thing students have been saying is just missing face-to-face contact and saying, you know, online's not quite the same. They miss doing things they enjoy. So a few quotes here, a really nice one. I just think seeing people, I think that's probably one of the best things for us. We're growing and we need our peers to check ourselves against, which I thought was really interesting. And a few others saying they just really miss face-to-face contact, particularly. School closures, actually, perhaps we've seen this reduction in anxiety due to some of these ideas. So I think I was a little bit relieved to get out of such a toxic environment with people I didn't like, but I'm missing the social aspects. A few others saying in some ways it was good because I don't really like school sometimes. So I guess just drawing attention to, you know, teenagers that do struggle in the school environment, because I know we've been hearing a lot about the general worsening of mental health, but perhaps the group that don't like going to school have had slightly different experiences. Learning at home, really variable depending on access to the internet and resources, but also sibling groups. So the quote at the bottom in purple, because I've got 3 younger siblings, it was just so loud, I couldn't focus with my work. I found it really stressful. But then the top quote in blue, I found myself doing more work than I do normally in school because I didn't have people distracting me. So almost kind of polar opposite examples depending on context. Returning to school, again, perhaps for those groups feeling less connected to school, quite a lot of people feeling daunted and apprehensive. So obviously we've had another lockdown now and they're thinking about, well, they're back at school now, but so for some examples, I'm not particularly looking forward to it. I've just got used to it being like this and it's actually been fun and I enjoyed it. So perhaps more positive experience. And this idea of having to, you know, mixing a lot with different people again and getting used to teachers again, as well as the top quote, I think a lot of people are going to struggle going back to normal, a bit daunting for me. So to summarise, I think these findings for me have reminded us of the kind of everyday pressures of school life for teenagers. but also just the importance of adolescents spending time with their peers and how important that is, particularly face to face, but also to try and refocus our attention on kind of making schools more mental health friendly, and the impact of the school environment on students' mental health. So yeah, thank you. Hopefully I didn't go over too much.
Thank you, Emily. That was rapid and very, very insightful as well. The variation really interests me. And you've all explained everything so well. We didn't actually get any questions, so I will skip, I think, straight over to Steph. And this is titled "Let's Move," I believe. So here we are, Steph.
Yeah, well, yeah, but I'm not leading an exercise class. You needn't worry. So we thought we'd just build in just a quick 5-minute breather for people to use that however they want to. So whether you'd like to just get up off your chair, have a little walk, have a little stretch, do a little breathing exercise. We had discussed making you do a kitchen disco. That would be my preference, a little bit of cardio, but I'm not going to force anybody to do that, and I'm not going to force anybody to leave their screens on. So if you just want to take 5 minutes before we go into the last session, and we'll start again at 5 past, if that's okay.
But I will now pass on to one of the other young co-producers who I had the pleasure of working with, and that is Simi. So over to you.
Hi everyone. Yeah, I'm Simi, and I'm one of the other young co-producers that Nathan said. The first person we have next is Hannah, who's going to be talking about youth under lockdown. So yeah, over to you.
Thanks, Simi. I'm just going to share my screen. Let's see if this will work. And I'll just change that to presenting. Can you see that okay? Great. I'll set myself a timer. It should be about 10, possibly 11 minutes long. So hi everybody, my name's Hannah King. I'm a lecturer in sociology and criminology at Durham University. And I'm going to be speaking a bit about a piece of ongoing research that I'm working with the team up there on the screen, very much thinking about the pressures that young people are experiencing right now and the pressures that are yet to come. So I'm going to present what is very much work in progress about young people and their experiences of lockdown. So I'll be reporting a little bit on some of the pressures that are bearing down on young people now, and also reflecting and speculating on the future pressures facing young people. And this is very much framed within an understanding that young people are usually talked about, not talked to, though most of the work we're looking at here today is an exception to that. This is still very much the case when we think about public discourse, the media, politicians, and those in positions of power. And also within a context of a history of young people usually being viewed as youth as trouble or youth in trouble. So, and thanks to our colleague Rob McDonald, who first put this presentation together and delivered a version of this just last week. So it's made my task a bit easier today. So the project began this time last year. More recently, we've had some funding from the Youth Futures Foundation, and it's been in collaboration with the North East Youth Alliance and Children North East. And it very much came from concern by ourselves as youth studies scholars that young people were being completely left out of debates about the pandemic and the impact of the pandemic on young people. So the research focused on the experiences of young people under lockdown. It's a very basic survey asking young people to tell us about how the crisis and lockdown were affecting them. So we had just under 1,000 respondents and a really kind of good representative sample across age, gender, ethnicity, and a range of other elements. So we're currently just starting one-to-one interviews with young people. So this research is very much ongoing. So in terms of some of the survey headline findings, this is very much about the current pressures that young people are facing. So thinking about young people reporting about more often than not strained relationships, sometimes better relationships, but more often strained relationships with parents, siblings. So for example, arguing with parents, feelings around wanting their own space, this idea of no real sense of time, of isolation, of loneliness, the idea around Netflix days, of life feeling very monotonous and feeling stuck and anxious, often with their own thoughts. We saw key themes coming through about worry, uncertainty and insecurity, young people being scared about the future, thinking economically and educationally, and really feeling how lockdown and the experiences of the pandemic are very much jeopardising their future. We saw hints at class inequalities. So one participant, for example, said, "There's no one I could ask for help since neither of my parents did GCSEs." Just an example about some of those class inequalities we see, particularly around digital access and education. We also saw coming through very strongly this widespread expression of mental ill-being, and that's in a context of a pre-crisis youth mental health crisis and cuts under austerity. So young people talking about feeling significantly more anxious, depressed, some talking about suicidal thoughts. We saw young people talking about the personal and family health impacts of COVID-19, some of whom were clinically vulnerable and very much worried about parents and grandparents. There was common support for lockdown restrictions, so very counter to the dominant narratives we see about young people. But there was very little reported contact with youth welfare or health services. And young people expressed lockdown in terms of missing milestones. So if these are the pressures that young people are experiencing now, what will the future hold? And this is where we think it's really important to contextualise current experiences within the precarious context for youth transitions that was already in place pre-COVID-19. So a key rationale for doing youth studies is to examine the youth phase for signs of social change and continuity. What's happening now in the here and now can tell us much about society at large. But there's also a second reason which we've become even more convinced about, and that's by studying young people's experiences, we can see how powerful social forces construct narratives and policies about youth that then serve the interests of the powerful. And we can very much see that when we think about the government responses and how young people have been framed during the pandemic. So we need to look at future possibilities, the structure of opportunities for youth transitions to adulthood. And this is within a context of long-term wage stagnation, the threat of downward social mobility, home ownership being impossible for most young people, rising youth unemployment in the 2000s. So we already knew that underemployment was already becoming the norm for young people. The impacts of the 2008 global financial crisis, young people hit the hardest, this idea of a new lost generation. We think about the austerity cuts since 2010 by the government, really deepening youth disadvantage, often targeted at young people, thinking about cuts to educational maintenance allowance, Sure Start, youth services, welfare conditionality. We also see dramatic rises in youth poverty, not something we usually talk about or hear much about, along with the rise of the gig economy, so 0-hour contracts, forced self-employment, low wages, temporary work for young people. And also the context of Brexit, which we might question as being the pulling in of socio-political horizons and economic opportunities, possibly by older generations against the young. So what we now see is a collapsing labour market. 88% of those who lost their jobs in the last year were under 35. And the example there that normally posts that would receive a handful of applicants have been receiving thousands. So for example, an advert for a job for a warehouse worker in Northumberland received almost 3,000 applications, significantly more competitive than getting into Harvard, for example. So what we have now is a collapsing labour market, which is particularly bad for young people, for young workers. So young workers are facing much higher rates of redundancy, job loss and furloughing, a third of 18 to 24-year-olds, and that doesn't include full-time students. Those aged 20 to 39 are most likely to work in the gig economy, in atypical jobs in sectors like hospitality, non-food retail. but furlough pay only covers 80% of contracted hours, not of the hours worked. So if you're a young adult who has a contract for maybe a couple of hours a week, but usually works over 20 hours, you'll be furloughed for 80% of that 2-hour contract. And that's just for the one job. So if you have multiple jobs, you're only being furloughed from the one. And as we've already seen over the last 10, 15 years, and through the global financial crash and austerity, graduates have also been impacted. So this is young people's experiences right across a really wide age rate, a really wide range of experience. So graduate recruitment's dropped by nearly 11% last year. The Centre for Economic Policy reported that there are serious concerns that the pandemic will push Britain's young people under the age of 25, the COVID generation, into a dark age of declining social mobility because of rising economic and educational inequalities. Without policy action to counter the threat, unprecedented economic and education shocks could inflict long-term scarring effects, damaging future life prospects for young people. And these figures here at the bottom by the Resolution Foundation, predicting employment rates post-crisis, are pretty dire, but that also needs being put within the context of what was already increasing youth unemployment and increasing youth underemployment before the crisis. So 5 key conclusions to finish. From our ongoing research, we found that young people's experiences confound popular stereotypes. They worried a lot about the risks of COVID-19 to their loved ones. They strongly supported lockdown rules, and they sometimes faced risks directly as key workers. These are key findings that other colleagues and presentations across this afternoon have also pointed out. The research indicated widespread mental distress among young people against a backdrop pre-COVID of a mental health crisis amongst young people and very stretched mental health services. Some of the problems young people face hint at old and new inequalities, particularly if we think about around income, digital resources, educational provision, physical space. We see that disrupted education, job losses and enforced economic inactivity add to the mounting problems young people already face, making transitions to adulthood even more precarious. So we've got the greater threat of downward social mobility, widespread precarity in the labour market, weaker returns from educational success, and the impossibility of the housing market. So this points to very heavy pressures to come for young people and young adults. And we think it really demonstrates the need for research and policy on impacts, outcomes, activism, inequalities, and essentially a really important role for policy for young people. And what we've called for as a manifesto for the social welfare of young adults. That's it from me, thank you.
Thank you so much for that, Hannah. I'm now going to pass on to Ola. Sorry, I hope I pronounced that right.
Yeah.
And we're going to be talking about teenagers' experiences of life in lockdown.
Thank you, Simi. I'm going to check. Can you see these slides?
Yep.
Brilliant.
Yeah.
Thank you. It's going to be nice being in a room again one day and not having to check that at the start of every presentation. So yeah, thank you for all presentations today. Been really, really interesting, and I think lots of the things that we that I'll kind of get into in terms of our study do resonate with lots of the points kind of picked up on today. So it's been really great to hear all the different work. So I'm going to talk to you a little bit about the TEL study. I'm going to do my absolute best to do that in 10 minutes. I'm going to dig into some key points, but we did have kind of lots of kind of things within the study. So that was led by myself with a number of colleagues who are also adolescent mental health researchers and also have experience in roles like secondary school teaching and school counselling as well. So the project, we were very aware in the very early stages when the pandemic hit and kind of lockdown came into place and everything changed, that a lot of the evidence that was emerging was very quantitative in nature. It was very statistical. We were making these judgments about where youth mental health was at without a lot of context, because this was a really, really unusual situation, and it was very, very difficult to kind of get a handle on what was actually happening in young people's day-to-day lives. So what we wanted to do was kind of try and offer some context and a bit of insight into that. So we focused on the 16 to 19-year-old age group. I think has been touched upon today that, you know, this is a group they've had exams cancelled. You know, this is normally the moment where they're doing that kind of final step of transition, or one of the final steps to transition to adulthood, and are normally very independent. They're normally taking a lot of steps for their future, and actually they've been thrown into a lot of kind of uncertainty and containment all of a sudden. So in that first lockdown, we asked 16 to 19-year-olds in the UK to tell us about what lockdown looked like for them, what it felt like, and how they were managing it. We gave that as a very, very open-ended prompt on an online survey. We did give some additional very neutralized open-ended prompts that they could use if they wanted to help them structure that. But essentially we said, we want you to tell us about whatever's most important for you at this time in terms of what this looks like, what it feels like, and how are you managing it. So we really wanted to give them that ability to focus on what was most important to them there, rather than restrict them to particular questions. Given that, you know, our idea was to really try and get that initial snapshot of what might be happening at this time. So we had just over 100 teenagers share their experience with us. So that was in May 2020, so very much in the first lockdown. It was just as things were starting to kind of ease up a little bit. And just a quick note on the kind of the nature of the sample, we do note there's issues here around representativeness. So the mean age was 17 and a half. We did get quite a good spread in terms of ages. Most were girls and women, which was quite interesting to us. So that's something to keep in mind when we talk about what we found. Broadly similar in ethnicity to what we expect to see among that age group in the UK, and also all were in some form of education. So we didn't reach you know, young people who are considered more at risk of that, or more kind of detached from that. So I'm going to tell you some of the key highlights, but I'm actually going to share with you a short version of our film that we made with our university drama students. So I'm going to pop that on.
The COVID-19 pandemic has changed things for all of us, young people especially. In May 2020, researchers at the University of Manchester and Liverpool John Moores University asked 16 to 19-year-olds nationwide what lockdown felt like for them and how they were managing. Here's what they told us. This has been an emotional roller coaster. There's been a lot of intense feelings to deal with, feeling sad, worried and frustrated.
I was terrified of anyone I knew getting it, especially my sister, who suffers from asthma.
Our futures started to feel less certain, and we worried about grades, work experience and job opportunities.
When it was announced that GCSEs were cancelled, I was distraught.
Looking after our well-being has been especially important this year, and we've all been trying to figure out our own way of doing things, like creating goals and routine, spending time outdoors, staying active and learning new hobbies, trying to stay positive. We've been missing people outside of our homes, especially being together physically rather than just over the phone. There's been a sense of community during the pandemic, in our neighbourhoods, in our country, even across the planet. It can be reassuring to think that we are all in this together.
I'm okay now because I understand that it's the most important thing right now to help save lives.
So how can we all take care of ourselves? It's okay to feel angry, sad and confused. Try and find new things to do with your time so that you feel like each day is a little different. Stay in touch. You're not alone. Keep talking to friends and spend quality time with your loved ones if you can. This is not permanent and it won't last forever. There is light at the end of the tunnel.
So you can see a slightly longer version of the film. It's just under 5 minutes on our website here, which I'll pop up at the end as well. You don't need to see the same thing twice. So just a couple of kind of key headlines, although it's certainly a taster. We did find that what young people were presenting to us was that this has been an emotional roller coaster and that there's been a lot of change and loss and uncertainty within that. So a lot of intense and difficult feelings for most young people, and also COVID fears as well, particularly for those, the ones who often noted that also said they or a loved one had a health condition that made them vulnerable. So that does seem to be a kind of particular feature there. Participants did describe taking care of themselves using lots of different strategies, but that wasn't always easy. And as I know we've touched on earlier today, actually a lot of teenagers lost the things that they would normally use to cope, and had to kind of construct new ways of doing that. So there was quite a lot of difficulty that some teenagers did report in doing that. Daily life changed a lot. I think that's hardly a surprise, you know, and the teenagers that took part told us, you know, they'd lost their routine. They were trying to complete work online, and that was really difficult. There was this lack of independence and a loss of purpose in their days. And we also saw a lot of discussion about this loss or sacrifice of normal teenage experiences. There was a lot of concern about rites of passage that were kind of lost, and worry about exactly how many they would have to give up in the future as well. And a lot of uncertainty about the future, you know, in terms of worrying about opportunities that had been lost that might affect their later opportunities, like losing work experience, you know, the impact of teacher assessed grades, and certainly the impact that the pandemic was having even in those early days for the job market, particularly for those that talked about things like wanting to go into hospitality, for instance. You know, at that time, that was one of the industries that came up quite often. So feeling connected has been important. Teenagers told us that having close and supportive interpersonal relationships did make lockdown more positive overall, or it helped them cope on bad days. But many did feel disconnected in some way, and particularly that was missing people outside of their household. And there was a lot of talk of, you know, remote contact was not the same. And I think sometimes it's easy to assume that adolescents were more equipped maybe than other generations to stay connected in this way. And there were a lot of young people who said, I can't text like this. And actually we had young people saying things like, you know, all my friends are doing Zoom quizzes and I have ADHD and I can't sit that long. So actually, you know, a lot of variability in how easy that was. And then when you could do it, it still wasn't the same. And feeling like we're all in this together did come up as something that at that time young people were really seemed to be holding on to as really important to them. There have been positives in lockdown, and Emily's presentation earlier, I know that Emily's findings came out just as we were finalising the report, and it was so interesting because this was fascinating to us that participants were really trying to find the positives. They were really trying to stay hopeful, and actually some of them described, even with the distress that they were experiencing, that some of the normal pressures they had were gone. And that, I think, is a really key point for us, that relief did sit alongside more difficult emotions. It wasn't that half of the participants felt one way and half the other. There was this kind of coexistence of difficult and positive feelings here. And there were new opportunities that they didn't normally get to grow and develop. They talked about enjoying their own company, evaluating what they wanted to do with their day and who they wanted to connect with, instead of just being in a group of however many young people all the time. Learning new skills, and also becoming closer with family, which surprised me, and maybe that says something about my relationship with my mother, that I would not want to be in lockdown in a house with them as now, let alone as a teenager. But yeah, there was a lot of talk of actually deepening family relationships and having more quality time. Not in all cases. There was some participants that had a lot of conflict in the home as well, of course. So a few strengths and limitations to keep in mind. I don't know how I'm doing for time. I think I've got a couple more minutes still. So we did, you know, a key strength for us was, you know, we were one of the first kind of qualitative studies happening last year, and, you know, getting that insight into what was actually happening for this age group at that subjective level beyond just kind of the dips in statistics that were being seen. That open-ended written account approach that we used really allowed participants to direct what they wanted to focus on and what was important to them. In terms of limitations, we were a single time point. This is very much linked to the initial lockdown. So it would be very interesting to understand how some of these have changed. And it's been great hearing from other points, some of the feelings that were similar and also different, and how different kind of public policy elements might have played into that. So for instance, we had a lot of talk about important personal sacrifices. And through all of the summer, we then saw a lot of blame on young people that really did not resonate for me with the kinds of experiences that the teenagers in our study were reporting about how careful they were being. So it would have been really interesting to kind of get more of a sense of their reactions to those things. There are issues around sample representativeness. As I said, we had a lot of girls and women, but also we're aware that this is an approach of disclosing your experiences that is probably inclined more towards some young people than others. This is writing about your feelings. So, we have emphasised that there needs to be that kind of range of different ways for young people to share in different studies at this time, so we can build that up across research. The study wasn't co-produced. This was actually, we ran without funding. We were told that a qualitative study was not generalizable, and so we were turned down for funding, which, yeah. So we had set up some initial plans for co-production, and then when the funding didn't come in and we decided to run ahead, it's been an interesting kind of learning curve and reflection for me, as well as a limitation for the study, because this is my first study where I've been PI, and also my first study where we haven't had access to a big pot of money. So the partners I'm used to working with in co-production are very much ones where we pay or where we go via schools, which actually weren't an option at this time. So it's one of those things I think if I could go back now with all the learning I've done in the last few months around how we might have mitigated that, I wish we could have done that differently, but yeah, and we are exploring a possible next strand that does incorporate co-production. So key take-home points. I'm not sure how I'm doing for time. I'll be one more minute. So definitely this has been a really multifaceted experience, and I think that's something that is captured in a lot of the qualitative evidence that's coming through, and partly in some of the quantitative as well. But yeah, for us, very much that there was that unease and distress, but also growth and opportunities for relief. The emotional impact has been intense, and that's include a lot of varied circumstantial concerns that depend on the individual, and those relate to both short and long-term concerns. There was a lot of concern around the future and employment and education opportunities, and that's not about to go away. Findings also highlight quite how much work teenagers have been putting into coping and taking care of themselves. And I think one of the things for us is this is an opportunity to reflect, as Emily has said before, on what adolescence normally entails, what are we normally expecting of teenagers in their day-to-day lives. And this is perhaps an opportunity to have some conversations with young people about learning from this. So our study highlights the need for support for adolescents, including but far from limited to directly in relation to wellbeing and mental health, particularly so for some young people. Support and prioritisation around social connection, not assuming that just going back into the classroom or being back in physical spaces is going to heal the kinds of disconnect that have been in place for the last few months or year now, should I say. Helping adolescents make sense of and respond to health information, public messaging, societal shifts. I've touched on our kind of points around that less today, but we did have findings relating to how they were feeling about elements of this kind of thing. And also providing advocacy for adolescents and their needs, both in an individual way and also as we kind of see policies emerging as well. So yeah, just a final slide of kind of our website here includes a full report, and we also have an advice for teenagers document, and we did receive later on some ESRC funding to create some different resources, including a video for young people and a kind of navigating tool for education staff and other staff working with young people to go and have a look at the many resources that other people have created in the last year. So yeah, I will finish there, and hopefully I haven't gone too far over.
Thank you so much. That was really informative. I'm gonna pass over to Steph now, who's going to be talking about lockdown life in the Northeast.
You're on mute, Steph, sorry.
Sorry, my mouse frequently freezes and then doesn't take me off mute quick enough. Hi everyone, I'm just going to quickly share my screen and then get started. I think I've got a bit of a tough job in that this is the final main session. Hang on, let me see. Can everybody see that okay?
Yep.
Yep, I'm just going to make it full. Is that one okay? We're good?
Yep.
Excellent. So yeah, I'm going to talk to you a little bit about a study we've been doing in the Northeast. It's a qualitative study and a diary-based study, and it's longitudinal in that we've been asking young people in the Northeast to keep a diary with us since June last year, and they're still keeping those diaries, and I'll explain a little bit more about that in a minute. But before I do that, I'm not going to talk about some of the impacts and implications of lockdown for young people, because I kind of felt that they'd probably been well explained across the other presentations. So instead, I'm just going to get you to listen to something from a young person who sent me an audio diary this week. And I thought it was particularly pertinent to include because it's the anniversary of the first lockdown. So I'm just going to try and play this. Let me know if you can't hear it.
It's been a complete year now since lockdown started, and that's made me feel really strange because the year feels like it's gone really fast. But then I can't remember the last time I had that feeling of hugging a friend. Does that make sense? And just the thought of like having a whole year and suffering from so much stuff and not being able to give my friend a hug throughout it all, it's yeah, it made me quite upset actually. I've met up with my best friend twice in 1 year, and yeah, I think everyone's just had a really bad year. And like I went through an LCD breakdown this time last year, like 367 days ago was when my OCD exploded out of proportion. And yeah, I'm in such a better place now due to medication. It's just scary to think that this time last year I was so ill and we didn't know why. And like I couldn't go in the bath without having the door open because Mum had to make sure that I was okay in the bath. That kind of just gives you an idea of like how bad mentally I was. And now I'm so much better. And I still struggle. But yeah, just reflecting on what year it's been, it's too crazy to think about. I did get my vaccine on Thursday, so that was really exciting. I'm so ready just to get this over and done with COVID now, because yeah, you just get tired of it, I think. But yeah.
I felt she said things better than I could.
It's been a complete year now.
Let's play it again. Stop. Right,
it's been a complete year now since.
There we go. I just felt that the participant could probably convey that better than I could, and that young person is a young carer, so that's why she's already had a vaccine. So yeah, at a broad level, the changes that young people have faced over the 12 months look a little bit like this, and this is taken from some work that Emerging Minds have been doing with parents and young people. And it's really difficult to see, so I'm not expecting you to be able to see the specific text, but it's just really to show you what that timeline of significant events has been like, and just how many shifts that young people have had to experience over the last 12 months. It's enormous. And what we set out to do in our study is a bit like Ola. At the very beginning of the first lockdown, we felt a little bit concerned, like Hannah as well. We felt concerned that young people's voices weren't really being heard in terms of sort of implications of the pandemic. We could see quite a lot of surveys, quite a lot of quantitative work, but at that point, we didn't see a great deal of exploratory work about how young people were experiencing lockdowns and social distancing and pandemic restrictions. We were particularly interested to know how young people were kind of dealing with school closures, how they were dealing with homeschooling, and what sort of implications it had from being separated from their social worlds, really. So we originally set out to do a very small, very discreet qualitative study that was meant to last 4 to 6 weeks with a follow-up interview at the end. And then we subsequently received additional money to keep the study going. So we kind of rewrote the methods a little bit and turned it into a qualitative longitudinal study. So it's multi-method. We've collected flexible diaries from young people aged 13 to 17. And what we mean by flexible diaries is that young people they're not governed by a particular format. They don't have to send a diary entry every day. It can be text-based, it could be audio-based, it could be pictures, it could be drawings, it could be poetry, spoken word, anything that goes really. but I guess the key was that they were in charge. Most young people have chosen to keep in touch either by Instagram direct message or by email. And then we're doing a series of serial interviews around about every 2 months with a subset of those young people, about 10 to 12 of them. And the final part of the study is a piece of co-produced cinematography with local arts companies that is about mainly audio interlaced with graphics and cinematography, but really focused on sort of not necessarily the experiences of lockdown itself, but what comes next about in terms of integrating back into society. What I'm going to present on today, we're in the middle of the next phase of diaries. So the findings today are based on phase 1 of diaries. So it's in that initial 4 to 6 weeks and follow-up interview. So we're talking around about the period from July to October 2020. So if you can kind of cast your mind back, that kind of as they were coming out of really heavy restrictions and across the summer period, but then also that re-entry back into school. I guess what we're trying to achieve with taking a diary-based approach and a longitudinal approach and a serial interview approach is to try and capture that journey in and out of lockdown. The young people in our study have gone through 3 national lockdowns, but also localised tier systems and localised lockdowns. In that, again, in the Northeast, we never really got out of tier 3. So young people in our study have been under some kind of lockdown for 12 months. I'm not going to spend a lot of time on the characteristics, just to kind of give a bit of a breakdown. We've got quite a fairly, not even, but a nice split in terms of gender, a little bit higher in terms of female, but that's still quite a nice split. Again, a good split in terms of age. And we've got, whilst I wouldn't say the sample is marginalised in any way, there are voices missing from this, and I'll get there later. In terms of levels of socioeconomic status and deprivation, it's quite mixed. Ethnicity is really largely white British, reflecting the Northeast. And we also took a measure of well-being, and we've taken that measure of well-being every time we've spoken to young people in the 2-month intervals. And we've used the Warwick Edinburgh scale for that, which just asks a young person to think about how they felt in the last 2 weeks and ask them to mark themselves on a scale for a number of questions. So what I'm going to do is just talk about 3 key findings, all from the first phase of work. Largely broken down into what we felt the mental health and wellbeing impacts were on young people, how the pandemic impacted on their education and their school life, and also young people's thoughts and feelings. It's been alluded to by Ola and by Hannah and by other speakers about how they felt that they'd given things up across the last 12 months and also almost been sacrificed in it. So in terms of mental health and wellbeing, the young people in our study felt that their life was complicated and different in ways that they couldn't have imagined. They frequently described the pandemic as surreal. They also didn't expect, I think like a lot of us, they didn't necessarily expect restrictions to be so prolonged. So they in their heads, they kind of, they'd adjusted to a temporary period of having to stay at home, being without their friends, being without the social institution of school. But then as that time period got longer and longer and longer, it became increasingly difficult to sustain. And they also, they expressed a real sense of loss, even grief, actually, for the life that they'd kind of taken for granted for pre-pandemic life, and they didn't quite know when and if they were going to recapture that. So this particular participant just says it felt a bit claustrophobic and felt like life wasn't really real in a way for a really long time. Most of the young people in our study described feeling lonely, and all of them, I think it's an obvious thing to say, but all of them missed their friends, their extended family, they missed social contact and sort of general levels of interaction. Several young people in our study, including the young person who spoke at the very beginning, had pre-existing mental health conditions or lived experience of mental health, and that was exacerbated because of lockdown. Regardless of any sort of pre-existing experience of mental health conditions, all of the young people in this study felt the winter months be very much more difficult than summer months, and that was because of 2 reasons. In the summer, there was obviously a release in terms of restrictions, so things were a little bit freer. They could meet people outside. Some things were open, even for a very short period of time. But also the winter months were difficult because of the cumulative impact of lockdown in that it's almost like a sustained sort of layering effect, that once they got to lockdown 3, they felt really almost fatigued in lots of different ways. And the experiences of lockdown for young people in our study were absolutely not the same for everybody. Most of the young people in our study felt that lockdown had a negative impact on their well-being, but there were some people in our study who had a positive experience of lockdown, in that school was the source of their anxiety. And once we removed that, okay, they actually felt a lot better, and that return to school has been really difficult for those young people. So whilst I'm kind of mentioning school, the impacts upon education and school life were pretty much central to young people in this study. It came up in lots and lots of different ways. So like I said, lockdown 1 was difficult in many ways and was a significant adjustment for young people in this study. But I think it was Emily who talked about her participant being in year 9, and that was replicated here. So for some people in our study, lockdown 1 was relatively uncomplicated by schoolwork because they weren't gearing up towards exams. It was the young people who were gearing up to an exam or were waiting for an exam result or transitioning to college who found this to be particularly anxiety ridden. And that importance of an educational transition was really, really highlighted by those who transitioned to college in this time. I don't know if anybody's on this call who's transitioned to college, but the young people who didn't sit exams and had teacher assessed grades almost described themselves as an imposter wrongly. They didn't feel like they'd gone through that rite of passage of sitting an exam, and they reflected on that frequently. And the young people who'd had a relatively uncomplicated existence in lockdown 1, as September grew closer, they articulated really mixed feelings returning to school. They wanted to see their friends, they wanted social connection, but they were really daunted by what they were going to experience and how that Jeremy discussed the setting being completely different, and they were worried about that. And for the young people whose school had communicated with them effectively, that worry was lessened. So it kind of represented the importance of good communication from your school. But overall, school and education was characterised by disruption. There were frequent periods of isolation for the young people themselves, their teachers and their classmates. But also, as life got busier again, and as schools tried to make up for lost time, young people had huge workloads. Teachers were really, really worried that exams wouldn't take place. So they were trying to get in as much mock tests and as much coursework as they possibly can to try and sort of evidence teacher assessed grades that they felt were to come. And young people were really daunted by those changes to the school. They were daunted by masks were tiring. They felt that social distancing went well for a really short period of time, and then it was kind of thrown out by many schools. And finally, this is really similar to some of the things that Ola talked about just before me, that young people felt they'd given things up to keep people safe, and that was a lot of missed milestones. Things like Zoom proms and like, I don't know, Zoom like school leaver parties and stuff like that, and they were really sad. They'd had a number of lockdown birthdays. But mainly, other than sadness, they expressed anger, mainly because things were constantly changing. They were really uncertain. They needed to be constantly prepared. They weren't used to watching the news this much. And they were really exhausted, and they were kind of operating at heightened emotional states because of that. And they directed that anger in 3 directions: the government for not acting fast enough and not protecting people, for the rules that were imposed on the ground, largely at school, but also in shops and restaurants, and then for those not following the rules and also not taking risks seriously. So yeah, just to kind of conclude, because I think I might have ran over in terms of time. To our knowledge, this is the first study to curate longitudinal diaries with young people over the course of the pandemic. There are other studies that have used it as part of a wider palette of methods, but not just with young people in the UK. There are international studies. And whilst children and young people are largely physically unaffected, that's quite rare, they are likely to experience the most long-term damage, and I'm going to come back to that point in a minute. And we kind of felt that whilst we should have all been in the pandemic together, young people weren't, and we kind of found further evidence of what Bambara refers to as a syndemic pandemic, that if you were already experiencing inequalities in any way, those inequalities are sharpened and widened because of the pandemic. So in terms of initial analysis of the next phase of diaries, we're collecting diaries now from January to June. What we're finding is huge levels of fatigue, particularly after that bout of homeschooling between January and March. Young people were basically sick of Zoom, which I am as well. They felt like they were going through cycles of continual adjustment. So the young people, I talked about it at a project meeting yesterday, young people in our study are really used to working towards exams now, whereas when I went to school, I was probably more used to working towards coursework. And that seems to have shifted, and young people are almost having to shift the way they learn. And also that there's a potential extension of adolescence in that some young people are at home when they wouldn't have normally been at home if they'd gone off to college or university or whatever. So we're a little bit aware that there are voices missing from our study. So we had a wide, diverse set of young people in terms of socioeconomic status, but there are voices missing from this work, particularly vulnerable young people or specifically marginalised young people, young people who were shielding, who were homeless, who were involved in households with domestic violence. The list could be endless. And the next phase of our work is intended to kind of implement that more centrally. So we're in that second wave of diary data collection now, combined with serial interviews. We're also doing in-depth interviews with school staff, which is why I wanted to ask Jeremy about his study earlier on. And then finally, the co-production of cinematography. And that cinematography is in partnership with creative industry in the Northeast, but also with youth groups of particularly marginalised young people in the Northeast. So just to kind of like highlight three things, Hannah said this in her presentation as well, that there's a real need for youth-led recovery. There's a question mark about whether we sacrifice our young people, and that adds on to a body of work suggesting that young people have been sacrificed in other ways, so Brexit, austerity, precarity. But the overall aim of this work is to co-produce a piece of cinematography, yes, but almost something that represents a rights-based framework of mental health support. So what young people feel they're entitled to, and can they kind of draw up their own agenda and their own youth-led recovery, basically. That's it from me. Thank you.
Thank you, Steph. That was really interesting. I think I related to a lot of the things you said, actually. So, yeah. Now I think we're going to go to the Q&A. And I think, yeah, we'll just be asking some of the questions that people have asked. So for the first question, someone was interested to know if there were any specifics about how, if anything specific has come out of conversations with young people about what more organisations and youth workers can do to support them. For example, accepting that the lockdown has happened, what are the biggest worries as we leave it, and what we want to, and what they want us to help them with. How can workers make sure we achieve our aspirations in the future? So yeah. Okay, yeah, Kat's gonna put it in the chat.
Thank you. Was that for me or was that for speakers in general?
Well, it's just in general, I think. But if you want to answer, then
no, it's more because my screen is frozen, so I'm having trouble seeing anything.
I mean, from the work that I've done with young people, the main thing that has come out is that we should be working together and really centering their voices. And that's what a lot of people is kind of a thread, I think, throughout all of these projects, is that that's what really, and someone else said it in the chat a bit earlier too, that when we're building kind of frameworks and when we're doing policy work and all of this and advocating for young people, it's really important that they get their say too and get to say things in their own words.
I think I can jump in as well and say one of the things we found in making the film that communicated those experiences, and then the responses we've had from young people, because we did ask young people what they thought of the film. One of the most overwhelming reactions was realizing that other people felt the way they did. And I think there's one of the key things we've discussed as a team in response to that is thinking about actually some of this is just about normalizing these as really healthy reactions to a really bizarre, difficult situation. And there are young people who are very good at expressing how they feel and looking to other people and hearing that back. But lots of young people actually may not be realizing other people are having the responses that they're having, and that seems to feel quite lonely, is what we're kind of hearing from them. So I think there's scope for just having these conversations and making clear that it's okay to feel the way that they do at the moment. Yeah.
I just wanted to add as well, so it's kind of echoing what the guys have said, but it's really bringing through this peer support that really came through in our project at both stages in the qualitative interviews, about actually everyone's experience things slightly differently, but everyone's experienced a lockdown or the pandemic or the COVID experience on their mental health and well-being, and everyone's been locked down at certain points. So that feeling of how they coped, to then being able to help another young person with their own experience of coping, really came through. And I think if we can try and facilitate that in whether it's a digital sense or in a sort of hybrid approach, sort of face-to-face and digital, I think that potentially might be a nice way forward in being able to support someone who's been through what you've been through, and vice versa, sort of a response and helping each other.
Yeah, okay. The second question is for Jeremy, and there's two questions actually. The first one is, do you think the use of pupil referral units increased due to COVID? And the second question is, does the UK in this case refer to England, and school policy on reopening has varied quite remarkably over the 4 nations? Yeah.
I'm not sure if he's still in the call.
He's gone. He had to go up.
He's not here yet. Okay.
So we can put some of those questions to him, because we're going to capture them and try and capture them in a blog later. In terms of the school sort of reopening side of things, I think, yeah, mostly we're referring to England rather than the devolved nations, particularly since that work is focused in Bristol. So I think that kind of would answer that question. Yeah.
Okay, that's great. So the next question is, do the speakers perceive particular issues related to stigma with regard to boys and young men in terms of willingness to speak/engage and their experiences?
I'm happy to jump in there. I know that there was obviously, I think that question came in as we were saying, you know, we did see more girls and women responding to ours, and I do kind of gender work around mental health more generally. I think it's a combination of multiple factors here, including some issues around stigma, and there is some evidence of kind of, you know, issues around willingness to report, but also the extent to which I think often boys and young men are taught how to and supported in developing skills around aspects of emotion expression. We know that even with really young children, we give much more emotional language to girls. So there seems to be a lot of different factors that come together. And I think for us as well, in terms of it being written, there's then another layer that we teach girls that they're good at writing, and we teach boys that they're good at doing other things. That there's a lot of different factors that I think can mean I think certainly that we saw less responses, and that can influence how much willingness there is to kind of report more generally as well.
Thank you. So the next question is, so someone says, I'm not in the UK, I believe there has been a push to have more mental health workers in all schools, and they were wondering if that is true. Do CYPs have easy access to a trained person in their schools who they can talk to about mental health?
There has been a push to have mental health workers in all schools. So there's the Trailblazer project, which is a push to have mental health professionals in school, but also linked to sort of anti-stigma programs around mental health professionals in schools. I'm not sure if there are mental health workers in all schools. There's also a push to have pastoral support that isn't necessarily mental health support. So some schools have things like learning mentors, things like that. I don't know if anybody else has any other reflections on that.
There was a commitment to have a school counsellor in every school. I don't think we're there yet. And certainly to have a mental health lead in each school. But again, then schools weren't given support in actually implementing that. So I don't think we're there yet with that either.
Yep.
Yeah. Hopefully, I think that will be something we can work together, work towards in the future, hopefully. Okay, the next question is, what can we do to help build on the knowledge and findings from the research done so far?
I mean, what a question. I don't know how everyone else feels, but I think you go, Luke, go for it.
I was just going to come in and say, I think what's been fascinating throughout this afternoon is the commonalities that we're seeing. And that's really important. And I think that what we can do is we can sit on our current kind of research projects, and that's fine and that's good and that's important knowledge. But actually, for me, there's something of, well, this is an opportunity and maybe even stronger than that, a necessity that actually we need to bring these together and find out, well, actually there's some real commonalities across the country here, actually, in terms of what we're finding. And so we need to be presenting this maybe more powerfully as one, and with some young people like yourselves that are here on the call, to kind of drive it forward. So I think that this kind of symposium doesn't stop here. We need to continue that discussion and think about how we can join up.
I think that might be a nice point to stop, because I'm quite aware that it's after 4 o'clock. I know that Lindsay might have suggested at the beginning, but for those who weren't here right at the very beginning, if you've asked a question and it hasn't been answered, the question won't be lost. So our intention is to save those questions and to write up a blog, sort of almost like a question and answer blog of those questions. We might get in touch with some of the speakers if they're specifically about your project. But I know that there's some big questions in there about inequality in class, and I know what discussion in the past few days that Rob is referring to, I think. So yeah, we will capture those and we will do our best to kind of circulate that in a timely fashion. And really, it's just to say thank you to our speakers. Most importantly, thank you to our young people who co-produced the conference with us. So we've got Nathan and Simi here particularly, but this was a team of eight young people who co-produced this conference. We're in an after school session, which is more youth focused, which starts in like 13 minutes. So I'm going to wrap this up quickly. And yeah, thank you very much for your time. It's been recorded, so once we get the recording sorted out, we'll circulate that as well. Lindsay, have I missed anything? I'm just aware we're late.
No, I think that's amazing, and obviously follow our hashtag. Anything from today will be captured in there, and I'm sure we're going to try and do some snippets of videos throughout as well, so look out for them as well. But thank you so much.
Thank you. Thanks everyone.